But in the woman who has a 21 days, a 35-day cycle, the luteal phase starts from day 21. So if you are testing for ovulation and you are doing it on day 14, you are not going to get an accurate result. So these things need to be clearly understood, and you need to rely on a trained person to get an appropriate result. Other tests that can be done include prolactin. Sometimes excessive milk secretion results from excessive release of a hormone in the brain. And then function tests are also important. Next slide. Treatment options include drugs. If you're not ovulating, we could give you clomiphene citrate, which is the most common one. It's a drug that is abused because women feel that if you want to get twins, just take clomiphene, and you are advised by fellow women. It can be dangerous. A colleague of mine almost died from use of clomiphene. So you need to be properly guided when you use such drugs. You may also require different kinds of hormonal therapy. Surgery may be necessary. The most common one we do is fibroid surgery or myomectomy, but you may require other forms of surgery to correct problems that exist. And in the long run, if all normal methods do not work, you need assisted reproductive technology. Assisted reproduction refers to procedures where you manipulate the sperm and the egg outside the body to create an embryo, and eventually you transfer that embryo back into the uterus. It started here in Lagos, and Professors Gira Osage and Ashiru were the first people in Nigeria to successfully carry out IVF in 1989. Initially, there was even a campaign against introducing IVF, but right now, it is proliferating across the country. I know that in Lagos, we have nothing less than 30 to 40 centers currently offering IVF. But in addition to that, Lagos State is the only state where it is properly regulated. The aim of IVF is not to produce twins or triplets, but to assist the couple in getting pregnant. And we've had situations where they are celebrating all sorts of abnormal births. Recently, some woman who was aged over 68 years got pregnant and it was celebrated. It's not something to celebrate. Our recommendation is that no woman above 54 years should get pregnant, because the medical complications associated with pregnancy can result in the death of women who get pregnant above that age. A woman in India was celebrated as the first woman to get pregnant from IVF. She died less than a very short while after the delivery of twins that she had, and her husband also died shortly after. So at the end of the day, it's not just about the couple getting pregnant. We also need to think of the offspring, because bringing children into the world gives you a responsibility to ensure that they're able to live to a stage where they can take care of themselves, not just to satisfy yourself that you got pregnant. Next slide. The emotional and psychological impact of infertility can be imagined. It's only when you encounter it that you understand what people go through. For those of us that work in the field, on a daily basis, you see different sorts of situations. And in the long run, I understand why a foundation like this would embark on what it's doing. Because we need to create awareness and educate ourselves. Such individuals also need a lot of support. And at the end of the day, if they are able to succeed, then we give glory to God. In many instances, no matter what you do, success does not come and you are unable to achieve pregnancy. You should also understand that adoption is also a mode of treating fertility issues. In some instances, couples require sperm because you cannot produce sperm and you cannot produce egg. The satisfaction in such situations is that the woman carries the pregnancy by herself. However, genetically, that child is an adopted child because it's not your genetic offspring. And so, I don't see any reason why you cannot adopt a child who has already been born, especially those who need parental care. So we also need to encourage ourselves to stop stigmatizing certain practices and encourage all that would assist in solving the problem. Support groups are important, and people who have infertility problems usually get together and encourage one another in getting treatment. Next slide. Raising awareness is key. This is one of the fora which we can achieve this. And I want to thank the Parah Family Foundation for this venture. This is the sixth, and I believe the next one will be even bigger than this. My association, the Association for Fertility and Reproductive Health, also tries as much as possible to do this. And I think we should go into a formal engagement so that it's not just and what a one-off thing. This month is Infertility Awareness Month worldwide. And I think this is one of the ways through which we can educate ourselves and the public. We are also a source of information. So when you go out, encourage others, tell others what you have heard, and I'm sure we are all willing to provide information. Prevention is the key, and from childhood, we need to start teaching our youths healthy practices that will preserve their fertility. In the past, we used to have a lot of rampant use of unprotected sex and high abortion rates. These days, I don't even see as many as we used to see when we were training. So we need to reduce indiscriminate sexual exposure, encourage healthy lifestyles, obesity and all that also contribute. And if you start from the beginning, then you probably would encourage the preservation of fertility for a time when you need to have it. In addition to that, early detection and early intervention are key. And career pursuit alone is not what we require. We also need to require development along the line. It does not grow in a day. In our country, we want to achieve everything within a very short period of time, and there's too much of impatience, especially for the quest for money. And for that reason, people are doing all sorts of funny things. But in the long run, we need to change the culture in our society to encourage young people to grow gradually. Life is a journey, it's a very long journey, and if you are in a hurry, you not end it on time. Next slide. So challenges exist ranging from the economy, lack of information, religion, some religions prohibit IVF amongst other things. We have cultural influences, tell others what they don't know and discourage people should get treatment. We have misinformation even from medical practitioners. And then generally, we need universal health care where everyone has the rights and opportunity to access qualitative care. Infertility is a disease recognized by World Health Organization. Most HMOs will not pay for infertility treatment, but all that needs to change. And this campaign is one of ways in which we can achieve that. Next slide. So, in conclusion, infertility is a public health problem. In Nigeria, early consultation is necessary, and we need to increase awareness and work with Parah Foundation. Next slide. These elephants with other animals were going to take a test, and all of them were asked to climb that tree. I'm sure you will agree with me that the monkey will probably win because he had an advantage over the elephant. Same thing applies to infertility. One size does not fit all. That somebody got a certain kind of treatment does not mean that every other person benefit from that treatment. Every couple has to be addressed individually, and at the end of the day, the solution is going to be unique to you. So, as quickly as possible, if you are facing challenges, seek care from the appropriate place. Next slide. I thank you all for listening.
I want to hold on a bit, sir, to give audience to those who might want to ask a question or the other. So if you have any questions, please could you kindly signify with the raise of your hand or ask for no, just signify if you have a question. All right, ma. Just before then, I also want to extend that same privilege to virtual participants. You might go inbox and put your question if you have any, and you can be sure that we'll get it across to Professor Priya. All right, please, let's make the questions very succinct so that we don't. Okay.
Thank you very much for your presentation. It was very simple and quite educative. My question is, you did mention that the cutoff age for a woman trying to get pregnant is 54. Okay, I do know that surrogacy is one of the options of getting pregnant. So, if this woman is not going to carry the pregnancy herself, can a woman who is older than 54 have surrogacy treatment? That's my question, sir. Thank you very much.
I think we heard her. Question is, surrogacy is an option for fertility treatments. And I said earlier on that the cutoff age for pregnancy we recommend is 54 years. And that if a woman above 54 wants to have a child, can she use a surrogate? It's a very difficult question to answer. First of all, because we need to explain why we put 54 as cutoff age. Medically, problems develop as you grow older. And it's been shown that from the 50s, medical problems in the women increase, especially hypertension, diabetes, and your ability to cope with pregnancy becomes much more difficult. Therefore, even for your own personal health, we advise against you carrying pregnancy when you are above 54 years old. But then, if you are 70 and you want to have a child and you have the means to use a surrogate who is, say, 28 years, you probably will be able to achieve the pregnancy using that surrogate. Surrogacy has become a scourge in our society, and we are exploiting a lot of people by the use of surrogates. First of all, if you are above 40, the likelihood of you producing eggs reduces significantly. Hardly will you find any woman that is 50 years old that will be able to produce any qualitative eggs that will result in a pregnancy. Therefore, such a person described is most likely going to use donor eggs. Even if you are using your husband's sperm or your partner's sperm and donor eggs, you are going to use someone else to carry a pregnancy using somebody else's egg that is not your own. And at the end of the day, nobody is going to see the woman getting pregnant. So you are using a third party or a fourth party to carry pregnancy for yourself. So there is no correct or wrong answer to this. And because there are no laws in the country, it is even happening right now. But you need to ask yourself what the rationale behind the whole thing is. I said earlier that you can adopt a child. Instead of that, you spend millions of naira, most times not succeeding. IVF is not always successful. And in the long run, with the hope of having a child that is not genetically yours. For whose satisfaction? Is it for the child or is it for you? So most times you are treating yourself, not trying to even have the child. And one of the reasons why we recommend that you should not have children when you are too old is because you will not live long enough to look after those children. If you are 60 years and you have a child today, by the time the child is 20 years, you'll be 80 years. Even at my age, I can't imagine myself going to do school run right now. It is a phase that you want to pass through in life. And if you are growing with your children, then you now understand what parenthood is all about. So it's not just about having the child. How can a 70-year-old man be playing football with a 10-year-old boy? You can't do that. But the child also needs such guidance. So we need to counsel ourselves and understand why we do what we do. There's no right answer or wrong answer to your question. But if you come to me We'll sit down, discuss it in detail. It's not just a mechanical thing. Oh, one for a child. Yeah, you pay money for it, but in the long run, we need to look holistically at the whole exercise and put the child in the center of it all. It's not about satisfying yourself, but it's about bringing up a child the way that child should be brought up.
Thank you. Thank you so much, sir. There are a couple of other questions, but before we go to that, I would have loved to ask the same question she asked. So I know that there is a session dedicated to that, where we are going to be having a knowledge and intervention for older couples. And I also use the opportunity to introduce the presence of Dr. Kenny Aileji, CEO, CMD, Lifeline Fertility Clinic. You are most welcome. She will be taking that session much later. But before we go to that session, there are still a couple of questions, and I will appreciate if you can. This one says, please, sir, in case a husband cannot produce sperm, likewise, can the couple go for the
Question, no sperm, no egg. What do you advise? 5 years, yes, you can, but you're going to use somebody else's sperm, somebody else's egg, and in the long run, you may end up getting a pregnancy or a child that you're looking for at extremely high cost. That child is not your biological child because you have no genetic contribution to the child. But if the woman carries the pregnancy, then biologically, yes, she read that she birthed that child. Legally, she is the mother of that child. Probably sometimes it's even easier than going through adoption in our country because I understand that adoption can be quite complicated. Like I said in my last slide, one size does not fit all. And we need to sit down and carefully consider all the circumstances surrounding each couple that comes in. In some instances, some couples come requesting what you're asking for and end up without not doing it, whilst others may eventually benefit from it. So I think I would address it on an individual basis and then based on what the couple think and what will be beneficial to the child after we have discussed it. Then you decide on what is possible. If you don't have sperm, you don't have eggs, one of the solutions is IVF, using donor sperm and donor egg. In a situation where you don't have sperm, azoospermia can be obstructive or non-obstructive, meaning that you are producing sperm or you may not be producing sperm at all. If you have obstructive azoospermia, sperm can be retrieved directly from your testes and used for treatment. And that may be the solution in such a situation.
Thank you so much, sir. Before I take the next question, I also want to recognize the presence of the representative of the executive director, Adrian Oops, Mrs. Ronke King, in person of Mrs. Ihuoma Azuru. You're most welcome. Please let's put our hands together to welcome her. You're most welcome. This other question says, please, how can a 50-year-old woman handle symptoms of menopause along with infertility?
Menopause is a different situation. If you are menopausal, you cannot rear children. So if you have menopausal symptoms, there's medical treatment for that. If you desire a child at 50, then you need IVF, most likely using donor eggs, and that can also be addressed.
All right, sir. We might need to run a little faster. There are a couple of questions from online participants here. This one says, a woman that is 42, is AMH test necessary? I don't know what that is, but I'm sure you will, sir. Bearing in mind that at this age, an egg donor is mostly advised, even if our eggs are good. That's one. This other one says, let me take two so that you can take them together, sir. Thanks for the information, sir. Please, anyone for 53 and above that wants to go for ART, that is IVF.
Let me answer the last one first. Yes,
All right, sir.
53
Yes, sir.
above, yes. Above 54, discourage as much as possible using yourself to carry the pregnancy if you are a woman. For men, sadly, we have an advantage over women. Even if you are 70, you can still produce sperm, and most times you can achieve a pregnancy. Then the first question was AMH. Every couple is addressed individually. We have cutoff ages that are arbitrarily set, sometimes based on scientific evidence. In the Western world, after 42, it has been shown in most instances that the ability to produce good quality eggs declines significantly. So in most practices here, the cutoff age for using your own eggs is 43. And if you're up to 43, we would advise you to use donor eggs. However, if you come at 42, normally we will test you. And if in addition to the test, the AMH test that is normal, there's evidence that you still have good ovarian activity, most times one will still go ahead and treat you. We need a situation where we develop our own nomograms here. And this is an opportunity for me to encourage our practitioners to collaborate with AFRH to report data. We have up to 200 facilities in Nigeria carrying out ART, that's assisted reproductive technology. But in this year, only 18 out of 200 submitted data. Therefore, the information that is going is that we are not doing anything. Recently attended an African conference where Egypt reported 60 to 90,000 cycles of IVF annually, while in Nigeria we're reporting 4 to 5,000. Meanwhile, our population is double Egypt's population, and we have more than 2 times the number of IVF centers in Nigeria. So where I'm getting to is that if we report our data and we're able to data, we'll be able to develop our own nomograms and identify what age we should use as cutoff for our women. In Japan, there's a lot of longevity, life expectancy is high, and their own cutoff age is about 50, because it's been demonstrated clearly that their women are still producing good quality eggs till then. So it goes back to the individual thing that I've said. Some women above 42 have even come and insisted that you should use their own eggs, and in 1 or 2 cases, they have succeeded in getting pregnant. So others are encouraged by this to say, after all, my friend who was so age got pregnant, so you should also do your own. But if you are tested and your own values are different from hers, it will be foolish to continue on a journey that will not result in any fruit.
Thank you so much, sir. That will be all for now.
Thank you.
Let's put our hands together for Professor for that wonderful session. Thank you so much for the words of knowledge. Thank you for your selflessness. Thank you for your availability. We really appreciate your coming. You're most welcome, sir. And immediately after now, we will have Professor Tijani take the floor. But before this, we were going to take the documentary earlier before now, and I believe it's ready. Technical with the documentary is ready. We will take that now. Please. And for those questions that we are yet to ask as we progress, if you notice that I have not thrown your question up, we will still make them available to our very able panelists to give them. The documentary, please. Our Family Foundation was envisioned in 2018. The journey so far has not been easy, having to cope with families and stress of waiting to have their children. The foundation needs every first Saturday has seat pavilion alongside leaders, where we encourage counsel families and invite fertility experts, family life coach, and Christian faith-based men and women of God. And our focus is on 3 areas, namely family life, medical, and spiritual. It's been quite an experience. I want to work with people, families proceeding for the kitchen room, stay really well, having their babies, Over the past 13 years, Parah Family Foundation has witnessed countless success stories of families once labeled as barren, now embracing the joy of parenthood, moving to tangible outcomes and blessings in the form of over 120 children, including multiple sets of quadruplets, sets of triplets, sets of twins, and single boys. Parah has been a huge support system to me and my husband and our children. As husband and wife, as couple, just be one. Be prayerful together, do everything together, go for medical together. Show love. I'll never forget that day when the doctor called me and said, "Good afternoon, man." I said, "Yes, good afternoon." He said, the test we carried out was positive. I said, eh? The one IVS, the other one's failed. So when we started the journey, we are 2018, he just came and said that we are going to somewhere today. I said, "Well, I follow you." So when we got to the program, we really blessed the name of the Lord, and they directed us to the doctor. On the 16th day, you just did the test strip. It was you. I just came back. I came back to my item. Morning, was it's positive. Positive. So positive. Anybody that has fallopian blocking tube to get pregnant is miracle. It's you. It's only IVF that the person can do. So my baby now. We are familiar with every paternal grandma as she is now. We have a very little. We finished the treatment. Doctor told us to come back after 2 weeks for our test. The doctor does give me the news, "Madam, you are pregnant." I remember when I had my baby, when they brought out the first one, the second one, the third one, the first thing that kept on coming from my mouth was, "What's it on? What's it on?" We don't need to stigmatize people. They are going through a lot already. And we should stand by them. We should speak about our solution, how God came for us, not just that God did it, God did it, God did it. The foundation pays a yearly visit to 2 adult jobs in Lagos with kids. We are also registered as a foundation with the Ministry of Youth and Social Development. Adoption units in providing support for members who desire the adoption option for solving their infertility challenges. To prevent future infertility challenges, Parah Family Foundation has launched the Youth Fertility Awareness Initiative, Wi-Fi, aimed at educating adolescents and youth on reproductive and sexual health in preparation for the future. Through the Wi-Fi initiative, we create awareness and advocate for young adults to pay attention to reproductive health and avoid any form of infections and unwanted pregnancies. This we do through the acronym of the PRESS: preserve, resist, separate, and sustain. On the streets where the youth are interviewed on their understanding of fertility issues. Is your egg? My egg, yes. Is your egg? The same way that. So, can you please mention sexual reproductive organs in your body? Yes. I know the pregnancy. Okay. Sperm is an organ. Fertility connects the another initiative of Parah that holds online interview with couples that have been successful at their journey, where they share testimony of their journeys to encourage other families facing infertility challenges. If you are trying to get pregnant, make it an intentional thing. You finish having your baby, you like go back to whatever thing you were doing. But be intentional about what you eat, about what you drink, and and try to lose weight. It's very important. We have done IVFs at some different places and it has failed. I went to our office, business office, if you remember, and I told her I'm not going to do it again. And she said, one more time. One more time. How am I going to sponsor this bill? How am I going to do this one? I don't have the money. But that one more time changed the whole picture. We took the treatment and it was a fast process and our babies came. And honestly, I feel emotional talking about it, but if I'm not getting that encouragement from the foundation, many people say it's witchcraft. Many people say it's this and it's that. But no, it's not really witchcraft. You need to look at what causes this problem. Heritage Hangout is an initiative launched to bring all Parah children together globally, irrespective of the location, in commemoration of the Children's Day. I want this to happen every year. I could even, if I was Parah president, I could even say it will happen every month because this bonds all the families of Parah together. We have to share and I want Parah Family Foundation fulfilling this mandate of fruitfulness is now expanding with the inauguration of Abeokuta Center 3 years ago. We had the USA online presence and the United Kingdom. We trust God for continuous global increase and impact. At the heart of our foundation's mission lies the belief that knowledge is power. The driving force is to indicate ignorance is driving rights and social stigma associated with delayed fertility. This is achieved through enlightenment programs, seminars, and conferences to demystify the myths, ignorance, and knowledge gaps surrounding infertility. The first conference held in 2018 with a team ABC of infertility, with fertility experts in attendance to demystify ignorance surrounding fertility. In 2019, Pathway to Fertility was also a success. In 2020, the conference could not hold because of the COVID pandemic. In 2021, the theme of the conference was bridging the gap in infertility. Infertility, managing the global pandemic, was a theme for 2022. As much as it is a dream and desire of every woman to carry a pregnancy, however, some circumstances could arise that would alter this. Several fiber surgeries done, no pregnancy, and the fibroid trips going back, several miscarriages. All these are issues. And you might decide to surrogacy at that point. You can no longer wait. While in 2023, the team was navigating through infertility in the 21st century. The losses and consistent and this is one of the The past conferences has been impactful. We believe has guided our choice of this year's conference with the theme Fertility, Need for Knowledge and Early Intervention. We should know achievements of Parah Family Foundation which have been possible without that. The long and long vision. To him we return all the glory, honor, and adoration. And to every family out there that are still waiting to have their children, your testimony is last. Useless of the Parah Family Foundation. But we also work about technical will be having Professor Tijani at about this time. But before he comes up, there's a little we want you to know about him, and the technical department will help me with that. Professor Abib Tijani. Of course, he's a professor of surgery, College of Medicine, University of Lagos, and a consultant urologist at the Lagos State University Teaching Hospital. If you are ready, please let's have that now so that we can have him take the session, all challenges that impact fertility in
Professor Fertility Abib Tijani attended University of Lagos. He teaching and participating in Nigerian University. And he came to Lagos to complete his residency at the Lagos University Teaching Hospital, Youth. In 2002, he became fellow in both bone surgery and urology for passing rigorous examinations. During youth as a consultant urologist in 2005, he later became a lecturer at the University of Lagos, ultimately achieving the position of professor in 2020. Internationally recognized for his scholarly contributions, Professor Tijani has over 70 publications in esteemed journals. His expertise encompasses urology, reconstructive urology, prostate cancer, in medical education. He led pioneering research on the PSA ratio among West African men and makes significant contributions to the understanding and treatment of most sexual disorders and fertility illness. His dedication to medical education is evident for numerous publications, including a groundbreaking study on the objective structured clinical examination and fellowship examinations. Currently serving as a professor of surgery at the College of Medicine, University of Lagos, and as a consultant urological surgeon at the Youth. Professor Tijani continues to advance the field from his expertise and content. Ladies and gentlemen, Professor Friendly Tijani, today's lecturer at the Parah Family Foundation Fertility Conference.
You are most welcome, sir. You're welcome, sir.
Good afternoon. I think we are in the afternoon right already, isn't it? Yes, ladies and gentlemen. Is it possible to? Yes. First of all, I must apologize. I have some. It can't. Don't worry. My voice may be a bit hoarse. I've been battling with upper respiratory tract infection. I was out of the country and I picked up some infection coming back. So I'll be talking about health challenges that impact fertility. While I was giving this topic, I really wasn't sure what I was going to talk about because there are so many health challenges that will affect male fertility. But I also had to consider the fact that the audience will be non-medical personnel. So I've tried to make this presentation as simple, perhaps even too simple, as much as possible. Next slide, please. Now, male infertility. Now, what makes male infertility unique is that, unlike many other diseases, a man that is infertile, infertility will not affect your mobility. It's not going to affect your strength. It's not going to affect your physical ability. So basically, it has a lot. It's more than anything else. And from experience, when you see a couple coming to the clinic and you see the woman talking and the man just sitting on one side, not talking much, you can guess. Most likely the man has male infertility or he has erectile dysfunction. Equally. And again, you should also take note, as Prof said earlier on, when a couple have problems with fertility, it is far, far easier to evaluate the man first. The test to evaluate the man is just a simple seminal fluid analysis. If it's fine, you concentrate on the woman. If it's not fine, you need to sort out the man. Now imagine the test that Prof talked about, all the HSGs and the rest, laparoscopy, very invasive test, complications. So it is easy. If a couple have a problem with fertility, for God's sake, the man should subject himself for the seminal food analysis first before the woman goes through all this barrage of very invasive and expensive tests. Next slide. We've had this definition earlier, so I don't need to go much into it. But the key point is that approximately 50% of cases of infertility will be due to the man. More reason why the man should subject himself for evaluation for the woman. Let's go. Okay, let's leave this. Let's go back to the old slide again. The old slide. Now, 50%. Now, again, when we talk about definition of okay, let's go. I think we have another slide for that. Next slide. Let's go. I mean, go ahead. Next slide. Next slide. Now, in normal couples, sex around the time of ovulation, which Prof has mentioned, usually 42% of couples get pregnant in 1 month, and 68% get pregnant at 3 months, and 86% of normal couples achieve pregnancy at 81% at 6 months, and 92% at 12 months. Go ahead, next slide. Next slide. Now, what is the definition? There's a medical definition used in all medical schools. We give to students, we give to residents. That is failure to conceive after regular or protected coitus for 12 months. That's the medical definition. But it's from the social definition, which Prof mentioned. But for the social definition, what we know is that Mr. X has married Miss Y. So if there's no pregnancy, it's infertility. Whereas medically, when we're talking about infertility, particularly male infertility, we are talking about the man having regular, normal, or protected coitus with his wife. Now, in the social context, that has not taken into cognizance the coitus, that is the erection. Let's go to the next slide. Okay. Yes, go back, sorry. Societal definition. Now, the society has not taken into cognizance the fact that for conception to occur, the man must have normal erection and he must also have normal ejaculatory function. Go ahead. Next slide. So when we talk about erection, normally the strength of your erection will not affect fertility. If a man is able to have an erection that is strong enough for vaginal penetration, that is enough for fertility. So it has something to do with strength. It cannot be Superman, strong, people rounds and so on, and you're just going to be a foreign boy, no action. Uh, so it has nothing to do. But however, if the erection is so weak that the man is unable to achieve adequate vaginal penetration, probably the woman will have issues with, probably the family will have issues with procreation. Next slide. Ejaculation. Now, premature ejaculation is actually more common than erectile dysfunction. Again, premature ejaculation does not cause infertility, except it is severe enough. For some men, it's quite severe that before they actually achieve any decent vaginal penetration, they ejaculate. The extremely severe type is not common, but usually when we have patients with premature ejaculation, some of the causes will include prostate problems, prostatitis, and then psychological problems. Go ahead, next slide. Premature ejaculation can be lifelong. I might just say, I have simply just picked some random problems and I think are relatively common that may affect fertility. So premature ejaculation can be lifelong. Some people will have it from the first time they start having sex, and some others it may be just it will be years. Now, there's also what is called an ejaculation. An ejaculation, the man does not have. Some of them will not have orgasm. That is, they're able to have normal sex, okay, and some of them will not have orgasm. Some of them will have orgasm and nothing comes out. So for this kind of couples, it's going to be a bit difficult. Some couples, at times the wife knows that the man is not releasing, but there are times that many times the man does not know that nothing comes out, especially if he has normal orgasm. Then there's the psychological component. In the psychological component, the man tells you that he has wet dreams. The only problem is that when he sleeps with his wife or his partner, he's unable to release. Some of the causes include, organic causes include drugs. There are some drugs that can actually make it difficult. A man will have orgasm and nothing comes out. Some drugs that we use for prostate, some drugs we use for hypertension, patients with spinal cord, diabetes mellitus can also have this problem. Next slide. Now, there is retrograde ejaculation. This is where the man sleeps with his wife. He feels he has released. And then he checks his organ and it's dry. Occasionally it is slightly wet. And what happens in this case is that instead of the semen to come out, it's gone back to the bladder. So when he now passes urine, he may notice semen or some slimy substance in the urine. That is what is called retrograde ejaculation. And for these patients, most of them they have orgasm. It can be partial in the sense that not all the semen goes back to the bladder. Some semen will still come out. And it can be total where all the semen goes back to the bladder. The drugs can be the cause. Patients who have had prostate surgeries, patients who have had some other surgeries, for particularly testicular cancer surgeries, and also have this. Go ahead, next slide. And ejaculation, ejaculation. Let's just go to the next slide. Now, what is the classical male infertility? In most cases, patients with the classical male infertility have problems with semen parameters. And for most of these patients, the semen looks normal. What we call semen, occasionally we call sperm, consists of, is made up from products from three organs: the prostate, and the seminal vesicle. The prostate that actually produces the sperm cells, the cells responsible for fertility, contribute 5%. So the remaining 95% of C, when we talk about semen, comes from the prostate and the seminal vesicle. So it is easy for a man to have a sperm cell and the semen looks normal. Absolutely easy. Because the testes, the whole fertility component only constitutes about 5%. So that's why I said, typically the semen, a lot of patients with infertility, the semen will look normal. And at times patients come to tell you and say, Doctor, I have watery semen, watery sperm. For us in urology, we are never bothered when the patient comes to say he has watery sperm. Because again, semen concentration, the organs like all these prostate and seminal vesicles, they produce the fluid. So the amount of water in what the seminal vesicles and prostate produce can affect how watery also the semen looks like. What is more important when somebody comes and complains that, or somebody feels that his semen is watery, so for that person to do is a seminal food analysis. When seminal food analysis is okay, then you don't need to bother yourself. Now, when you look at the some men, when you look at this semen, some semen will contain no sperm cell. That's what we call exospermia. Occasionally, some semen may contain sperm cells, but the quantity is low, the density is low. That's what we call oligospermia. And there's leucospermia. Well, yes, the sperm cells are normal in entity, but majority of them are. Next slide. That's what is called exospermia. Well, the sperm cell, the sperm density is normal. That means it has a normal sperm count, and but the majority of them are abnormal. As the point showed the other time, or you see a lot of some of them with double heads, double tails, and so on. Hypospermia. It means when the man ejaculates, the quantity of semen is small. Normally, we expect a semen volume of between 2 to 6 mils. So usually, average is 2 to 5.5 mils. So if it is small, the quantity may be so small, and even if the concentration is normal, if the quantity is small, that is called hypospermia. In other words, in this case, the man notices that, or the man is sent for his seminal fluid analysis, and the amount of semen that comes out is small. Hypospermia. There are some men when they ejaculate in about 15 mils. It doesn't make you a Superman. Usually, it's abnormal. So that if the volume again is so much, it's very likely that there's going to be a problem with the sperm density. Okay, so doing descent is best. Next slide. Now, who are the men at risk of fertility? Any man can have infertility, but what are the chances? What are the things that may increase the chances of a man having fertility? BMI, the basal mass index, that is your weight. It's well known that when the BMI is more than 25, of course, if you can even calculate your basal mass index yourself, just get your weight in kilograms and divide by your height in meter height squared. So patients with BMI greater than 25, in other words, obesity increases the risk of infertility. Yes, we don't have what is classical menopause, or what we call andropause in men. Now, for a woman, the menopause is straightforward, it's definite, she stops ovulating. In men, we also do have andropause, but it's not as dramatic as you have in females. So in men also, as we get older, our fertility will reduce. So fertility for men also reduces after the age of 40. But the only difference between men and women is that for most men, it hardly ever goes to zero. Next slide. Exposure to toxins, particularly lead, calcium. We know that individuals that work in bio industries, individuals that work with hydrocarbon, but particularly petrol stations, pesticides. We will work with companies where you use mercury. Those things are known to have spermicidal effect. In other words, when you are exposed to this, it may also increase the risk of infertility. So a man that is having issues with fertility should consider his exposure, particularly where he works. It's alcohol, marijuana, tobacco, that's cigarette smoking and the rest, if all been implicated. So this will increase the risk of fertility, of infertility. So any man who is having problems with fertility will need to watch this. Drugs. Particularly drugs used for prostate. The ones used for prostate cancer will affect the sperm count. The one used for the benign one will affect your ability to ejaculate. And I always warn patients and starting the family, once they start having prostatic symptoms, prostatic symptoms can start even before 40. And what are the prostatic symptoms that we should watch out for? Particularly the frequency of urination. You realize that you now go to the toilet to pass urine more frequently than before. Possibly we attribute it to diabetes, but it's not true. If you are above 40 and you start having to go to the toilet more at night to pass urine, you start noticing that you need to rush to the toilet, or else you are going to pee on yourself, or you start having issues like you've passed urine and you still felt as if some urine was still left in your bladder, you already have prostatic symptoms. And ultimately, you will, whether you like it or not, require medication. Medication, whether it's a medication or the surgery, will significantly affect your fertility. So once you start having those symptoms, there are signs for you too. It's not just women that should be bothered about 40. Well, that should be bothered about premenopausal symptoms. When you start having those symptoms, they are actually your own indirect pre-andropausal symptoms, because the medication you will have will either affect your fertility permanently or close to something permanently. Next slide. Other things that will increase your risk of fertility, you are involved in activities that expose your testes to significant heat. Hot tubs. We know that individuals that are on wheelchair, being on wheelchair normally should not affect fertility, but when you are wearing tight pants and so on, long distance journeys where you are constantly sick, medical injury driver. These are factors that we know, because you see the testes, the reason why the testes are outside the body is to require less temperature. The average temperature of the human body is 37 degrees. The average temperature of the testes or the scrotum is 36 degrees. So there's a reason why the testes are out there. Higher temperature will affect the ability of the testes to grow, and will affect the ability of the testes to perform normally. Next slide. Each step on the sundet testes. I think I'm still going to talk about it later. Sure. The almighty question people ask. Radiation, yes. We know that radiation, radiotherapy for cancer or chemotherapy for cancer will affect fertility. And people who are going to have therapy for cancer, they are only advised that if they are talking about fertility, they will need to see the fertility experts, or maybe to keep a sperm bank, and to keep their semen in the sperm bank, because it's not a guarantee that your the fertility will be on. Now, self-regulation. The self-will affect fertility. The reality is that there have been controversies, but the evidence is stronger on the fact that the self-will can affect the quality of the sperm cell. the sperm cell, the cell frame will not affect the sperm count. Now, what mentioned something about idiopathic or unknown fertility of unknown causes. One thing we know, even for male fertility, is that despite all these parameters we check, sperm count, the morphology, the motility, whether the sperm cells are moving, whether the sperm cells look normal. You can actually do a sperm count, there's a similar analysis, and everything looks normal. And because there are still other don't know that make it's like that actually that the sperm cells that influence the ability of the sperm cell to actually fertilize the egg. And that's what happens in some cases of mutation. Particularly, there are some what we call supervisor produce. I don't want to bother with all the medical jargons. But the key thing is that evidence is becoming stronger that the cell phone may actually have negative effect on fertility. Now, the key thing also about cell radiation from cell phone is that the radiation is more when you are picking the calls. So at times, putting your phone in your pocket and using the earpiece, wireless earpiece, may not necessarily be an advantage because that's actually the time when radiation is worse. So, the sort of what is not a problem. We have retired. It's basically for those who have not retired, our children and the rest, that they probably need to be cautious about the use of cell phone. Now, varicocele. I'm going to talk about that later on too. Drugs, testosterone. I'll probably just mention this. A lot of athletes, and it has been banned in conventional sports, but a lot of bodybuilders still use anabolic steroids to build up muscles. One of the greatest effect is permanent infertility. Testosterone, and again, well, the gynecologist is here. A lot of gynecologists just see patients, men with infertility sperm count, and the next thing to do is to give him testosterone, sostanon, provolone, and the rest. The reality is that, just as I mentioned, lab tests, a lot of lab tests, particularly those hormonal tests, it's very dangerous to rely on just one because a lot of them do many funny things. But the danger is that if you give testosterone to somebody who does not need it, you are going to render that person permanently infertile. So there's need to be cautious, serious caution when you go to a doctor and the next thing the doctor starts giving you is to go and buy provolone or buy or start giving you some jabs. So testosterone, yes, it makes you more aggressive. It can improve your libido, it can improve your erection, but the danger is that it can render you permanently infertile. Next slide. So again, staying on the causes, some medical conditions, diabetes, autoimmune diseases, some of these, I don't want to use big terms. There are some autoimmune diseases that will affect the cloud, the limbs, so that there may be there will be a link between your problems of having arthritis over your joints and also having infertility. Some immune diseases, basically, the individual destroys his testes. Infections. Yeah. The general perception is that when people have infertility or low sperm count, it's due to infection. The reality is that infection it's not a common cause. At times, people will call somebody treated for staphylococcus. Staphylococcus doesn't cause infertility. As a matter of fact, infection will not cause low sperm count. That's anything at all. If your semen shows a lot of poor cells and dead cells, infection will be the cause. But it does not show leukospermia or does not show cells, you can take all the antibiotics in the world, it will make a difference. And when we talk about infection, we're talking about classical infection, the gonorrhea, the chlamydia, the syphilis, and the rest. not staphylococcus. Staphylococcus does not cause infertility. Staphylococcus is a common commensal. So if you like to take antibiotics, the so-called staph will clear your system, but you put the microbiology later test later on, it will go back because it's just a contaminant. Next slide. Next slide. The next slide. Occasionally, infertility may be associated with low testosterone. And as I mentioned, nobody should give testosterone except he has confirmed that or the doctor has confirmed that individual has low testosterone. And don't let anybody give you testosterone based on one test. Invariably, do this test at 2 or 3 different labs. If they now show that the testosterone is low, then you can have testosterone. But some of the symptoms that may show that your infertility may be due to testosterone is that a lot of patients with these features will have problems with erection, libido, they just lose attraction for women. They may have, they lose aggression, loss of body mass, and then they can put on weight. So these are some of the features that you will see, because normally you don't even want to treat a patient just on low testosterone alone. The patient should have low testosterone and must have symptoms. So sometimes patients with low testosterone or hypogonadism, they have these symptoms. Next slide. Now, I specifically picked one or two problems that can cause medical disasters. Testicular torsion. I specifically mentioned it because recently I was an expert witness in the medical council on a case of testicular torsion. Now, testicular torsion, this is common basically in adolescent, teenagers, but it can affect anybody. And what happens in testicular torsion? There's a twist. And of course, because of there's a twist in the cord, in the blood, the cord, basically the tube that carries blood to the testes, causing pain and swelling. Now, the unfortunate thing we've seen in this environment is that when a man, particularly a young man, goes to a hospital with testicular pain and swelling, the first diagnosis is infection. In reality, infection is an extremely unlikely cause for a teenager, and it's almost impossible for an adolescent to be the cause of his testicular swelling. And teaching is always, if you are not sure, you must assume it's torsion. Because in torsion, if you do not intervene immediately, now let me tell you this story that I was talking about. A young man went to a hospital and then he had swelling of the testes and then he was given antibiotics. The swelling, of course, after some time, the swelling will normally for torsion, even if you don't operate, the testes will die a normal death because there's a twist, there's a loss of blood supply. So the pain will finally go whether you give drugs or not. And the swelling will also go down. The only problem is that when the testis gets to this normal size, it doesn't stop going down. It continues to go down until it becomes like a size of a pin. That testis is gone forever. Now, this individual had this swelling on one side, went to a hospital, they gave him antibiotics. After about a week or 2 weeks, swelling started going down, pain disappeared. Unfortunately for him, he developed swelling on the second side. Because he wasn't satisfied with the first hospital service, he went to another hospital and they did the same thing. So by the time I saw him, I think the mother was also a matron at one of the teaching hospitals outside Lagos. The man had lost the 2 testes. So because the reality is that infarction, when somebody has testicular torsion and swelling, inaction within 4 hours can lead to permanent loss of the testes. So it is very important. There's one message you must have here. do not joke with testicular pain and swelling. A lot of patients who are going to have torsion that's going to destroy the testes, many times there will have been small warnings, pain that will come and go, pain that will come and go. Please, if you have pain that comes and goes, don't let anybody tell you it's an infection. The only time you can think of infection is if that individual also has symptoms of what we call chronic urethritis. In other words, it tells you that he's had sex recently, unprotected sex, and he has been discharging pus per urethra. If somebody does not have that, never think about torsion. Never allow any doctor to tell you that it's torsion. And never ever accept, never allow any doctor to tell you that it's infection. And never accept infection as a diagnosis for a child. We've seen so many disasters. Children losing their testes because of diagnosis. Let's go to the next slide. Next slide. On the standard testes. This is only the second thing I want to mention, because we see this also. Any child, any male is born, when you go and congratulate the family, please confirm whether a doctor has examined the scrotum for the testes. Quite often we see adults coming in with infertility, and we realize that the testes are not in the scrotum. You do a scan, you find the testes maybe higher up in the groin, and so on. Medically, there is no hope for such people. The key thing is that if the testes are not descended, it will not affect the man's erectile function. It's not going to affect his sexual function in any way, because the cells that are responsible for testosterone, for all the things that make us men, are never affected. But it is the cells that produce the sperm cells that are destroyed. And if any child does not have the testes in the scrotum before the age of 1 year, you have to bring it down. You have to bring it down. It's so amazing when you see some parents bringing the son at the age of 6, 7, 8, 10 years, noticing that, they just noticed that the testes or the two testes are not there. It's at that age, there's very little you can do. You can bring the testes down, but these testes are not likely to be functional in terms of the ability of that individual to produce sperm cells. We don't remove them. Another thing about these testes is that once they are not in the scrotum at birth or at 1 year, there's also a potential risk that they can become cancerous. But we don't remove them because of the fact that these testes produce testosterone. That's why it's not conventional anymore. The man will still be able to perform, he's still going to produce semen, but the semen will contain no sperm cell. Unfortunately, these are the type of patients that you cannot help. So it's so important. Some patients are lucky if it is just one testis that's undescended and the other one is descended. You may be lucky because individuals may have normal fertility with one testis, but 2 good testes are certainly better than 1. So the message here, as a parent, as a grandparent, let your children know. As a healthcare giver, make sure that you examine the testes. If you go and visit any relation who are just giving birth, please tell them, as a doctor, examine the testes to be sure that these testes are in the scrotum, because you can make a lot of difference. I think this should be the last slide. Next slide. Okay, yes, varicocele. So 3 things. I mentioned testicular torsion. I also mentioned undescended testes. The third thing, the final one will be varicocele. Both mentioned varicocele. Varicoceles are the most common causes of secondary infertility. An average person with varicocele will tell you that, well, when I was a young man, I had many girlfriends and they got pregnant for me. Or if you're in a polygamous setup, the man will say, well, my first wife had 3 children, so I don't know what's wrong with this second wife, that she's unable to have children. You can see those children, they look like me. 9 out of 10 is varicocele. Varicocele is shown the picture. Next slide. I think the picture is there. Yes. You can see the one that's on my right, on your right, that's what the veins are supposed to look like. Whereas the one on the left, you can see those veins very distended. What happens in varicoceles is that blood that is supposed to flow up, these veins have incompetent valves. Valves are supposed to allow blood to flow in one direction. When the valves are incompetent, the blood flows back. And blood is warm. Blood is 37 degrees centigrade. The testis requires 36 degrees centigrade. So when there's so much blood surrounding the testis will not perform normally. Most people with varicocele, we assume varicocele actually start at birth and starts manifesting as adolescents. There's nothing, if you are going to have varicocele, there's basically nothing. Let's go back to the old slide. So about 40% of subfertile men have varicocele. And another thing about varicocele is that, yes, sperm count may be low, but at times sperm count is absolutely normal. Everything about the sperm is normal. And yet the man is unable to fertilize the wife's egg. Many times when you see patient with huge varicocele and you operate, it clicks. So it's just to emphasize again that there are other things with respect to the ability that affects sperm, the sperm cell's ability to fertilize that we still don't know. Let's go to the next slide. Next slide. Okay. So they develop around puberty and develop over time. You'll see you'll see some men who will have, you see some men at 40, 45 with huge varicocele. And you ask them, they tell you that they have no problem with fertility. Most times, they were lucky they got married early. The effect of varicocele gets worse with time. So if you get married early, you may actually complete your family without knowing that you have varicocele. Next slide. Yes, it's more common on the left. But how do you know how do you know you have varicocele? At times you may not know. But varicocele can also present with pain. You may also feel that, particularly on the side that is worse, the testis drags down. And when you feel that cord that holds the testis, they look like a bag of worms. I don't know what a bag of worms feels like actually, but I know what a varicocele feels like. But we say it feels like a bag of worms. And the other thing about pain from varicocele is that you notice that when you lie down, the pain tends to subside. Next slide. As I mentioned that bag of worms. Next slide. The other thing you should take note, and we advocate this for adolescent health. If a male child comes to you, to your clinic, and you're evaluating, spend about 1 minute or so to examine the testes and see whether one testis is significantly smaller than the other. A lot of patients that are going to have problems with varicocele as adults, affecting their fertility. When you examine them as adolescents and teenagers, you will have noticed a significant reduction in the size of the testes, usually on the left compared with the right. Next slide. Yeah, I mentioned that not all patients with varicocele will tell you complain of fertility issues, because usually most times it's because they got married early enough. The other thing about varicocele is that varicocele can affect a man's fertility at 20. For the other man, it may be at 40. Because there are so many variables involved. Let me give you an example. WHO says the average sperm count, minimum sperm count is 15 million. But we know that some people have 200 million, 300 million per male. So If varicocele is going to bring my 400 million to 80 million, it's nothing. But the man with a normal count of 20 million, and varicocele cuts down around 70%. You know what that means? That takes you to around maybe 4 million or so. So that's some of the factors why some men at a particular age, compared with another set of men, are still fertile, whether they have varicocele or not. Next slide. Now, we know that varicoceles affect fertility. The question has always been that does it affect sexual function? The evidence is not with nobody knows why. Nobody knows whether it's correct or not. What we do know that a lot of men, when you operate their varicocele, the first thing they come and tell you that their erectile function has improved. We do not know the mechanism, and we do not tell patients who have varicocele and who have erectile dysfunction and they should go and have surgery for erectile dysfunction. You can get your fingers burnt. So advocate surgery for varicocele if it's affecting sperm count. But if there's an improvement in the erectile function, we call it a bonus. Next slide. What are the other things that varicocele can cause? No testosterone, that may be the reason for the erectile dysfunction. But we should remember this, varicocele can rupture because they are veins. They are big veins, they are thin-walled, and the average trauma, the average kick, the average punch that will not affect a normal person. If the same force is applied to somebody with varicocele, the varicocele can rupture and cause significant bleeding. So why do you want to operate varicocele? Infertility is one. If it's causing severe pain, that's another reason. And of course, to prevent rupture, or in case of rupture, we need to operate. I think this should be the last. Diagnosis, okay, physical examination. Most varicocele should be able to diagnose by examining the patient. But presently, the best, not necessarily the best, the gold standard is something more invasive. But for this audience, the best is a simple ultrasound scan. A simple ultrasound scan will confirm varicocele, and then treatment many times will require surgery. Next slide, that should be the, hopefully I'm going to be correct this time. Next slide, that should be the last. Thank you very much.
Thank you so much, sir. All right, let's quickly take some questions. And after now, we go for a comfort break. Do we have questions, or we continue from where we stopped? Do we have any questions for virtual participants? And by the way, there are about 40 virtual participants. So that's quite a lot, almost as much as those of us who are seated in the hall. Please, let's put our hands together to appreciate them. We love you for joining us. Some people are signaling for paper to write their questions. All right. Once we are done with this, with the questions for this session, there is a kind of Wi-Fi that is different from the one you know. So they are going to tell us the password when they come. But let's just quickly wait for them. And Prof said there are two basic ways of examining varicocele. Yeah, he said physical and simple ultrasound, he said. Mommy's in the house, you might have a duty to do to check. He said it looks like bag of worms. Physical examination of whatever looks like a bag of worm. All right, that's on a lighter note. This one says, will it be hard for a woman to conceive because her immune system is weak? So, is that the only one we have?
A difficult question, and it's type of question you don't give medical students, but they will curse you. It's very difficult to answer. The breast immunity generally can affect anything. So it has to be, I mean, to some degrees. Okay, I talked about having respiratory tract infection. I assume that my immunity was depressed at that point in time. I picked it up. So yes, I mean, if you really want to take it as high as, I mean, take it, yeah, as far as possible. Yes, if immunity is depressed, immunity depression can affect any part of your system. So your can affect your ovulation, can affect your hormone balance. Yes, I'll probably say that, but it's not it's not a common cause of infertility.
Thank you so much, sir. Any other question before we round up this session? Please, are there questions from the virtual participants? All right, while I await that, I want to recognize the presence of one of our equally esteemed guests who walked in the course of the session, in person of Dr. Ido, the Executive Secretary, Health Facility and Management Agency. Please, let's put our hands together for her, the Executive Secretary of IFAMA. You are most welcome, ma'am. Okay, I believe this is likely to be the last one for this session. How to inspect a teenage boy by a mom, or do we have to go to hospital to check? Probably this is saying, how do you inspect a teenage boy as a mom, or do we have to go to the hospital for a check?
Okay. Well, the first thing is whether the teenage boy will allow you to examine him.
Yeah, I think that's the concern here.
Because from experience, most teenagers are not going to allow the mom to examine. So your best bet is to examine when the boy as a toddler. As a matter of fact, if you are going to detect unintended testes at teenage, when the child is already it's already a teenager, it's too late. So you examine this child preferably before the age of 1. And if for whatever reason you didn't do that before the age of 1, examine this child as early as possible. The earlier the testes come down to the testes comes down to the scrotum, the better.
Thank you, sir. Thank you so much, sir. This says, can somebody with azoospermia be able to be pregnant as a woman? I think as a man, be able to impregnate a woman. Now I'm just trying to infuse some missing word in the question.
If it is azoospermia, it's not possible directly. But the professor of gynecology already mentioned here, the fact that somebody is azoospermic, it does not mean that that individual cannot have a biological child of his own. Once you are able to detect sperm cells in the testes, what these patients do, what you do for them, usually ICSI, intracytoplasmic sperm injection. So you draw the sperm cell and then you get the egg. So it's not all azoospermic patients that will be unable to have child or genetic children of their own. So it depends on many factors. If you are lucky and they can find sperm cells in your testes, then you have at least overcome one of the most crucial step of having a child of your own.
All right, Prof. Maybe we probably round off on this note. It says, can a man that has big scrotum be fertile, though not painful, just big?
Well, that's a different concept on its own. Because big scrotum, many things can cause big scrotum. I'm sure you see, for those of us in Lagos, we see some of them on the street with giant scrotum and so on. Many things can cause that. It can be, one of them is a hernia, one of them is a hydrocele. Big scrotum that is so big, and what we call giant scrotum now in medicine, we're talking about a scrotum that is as big as the head of the individual. The average big scrotum that you will see in a hospital, what we call hydrocele hernia, normally will not affect fertility. But when you have this big scrotum as big as the head of the patient or bigger, yes, they will compress the testes. So ultimately, so again, this compressive effect is not, it's we're talking about long-term compression. So Anybody with a giant mass in the scrotum that has stayed there for years will very, very likely have fertility issues. And we've seen quite a few of them. Yes. But it's not that it is impossible for that individual to have a child, but it will significantly affect that person's ability to have a child.
All right. Thank you so much, Professor Habib Tijani. Can we just put our hands together to appreciate him for the awesome session he has given us? You're most welcome, sir. Thank you so much. Thank you so much, sir. Thank you, sir. So at this point, I'll be inviting the Wi-Fi team. I believe they have something for us. And after that, we'll have a comfort break of about 5 minutes. The conveniences are to our right when you step out of the hall. And if that is too busy, you can walk all the way to the end of the hall. There are more facilities there. Wi-Fi, please.
All right, good afternoon, everybody. Good afternoon, everybody. We won't take too much of your time. We just want to introduce the concept of Wi-Fi officially. I know as many people that watch the documentary, you would have seen Wi-Fi go on the screen. So what is Wi-Fi? Wi-Fi is Youth Fertility Awareness Initiative, and our vision is to eradicate. Our vision is to eradicate and educate people and young adults, especially those who are not married, on the issue of sexual health and every reproductive topic that needs to be said before getting married. So who our vision or who our mission audience? Our mission audience is youths, adolescents, and young adults, and just before marriage. Like the phrase when I was in year one, they would say catch them young, right? So we're going out to catch them young and have them have this knowledge right before they go into marriage and they don't go uninformed. We have 3 projects that we are currently running. Last year we officially launched. We've been running since 2021, but last year we officially launched and we're present at the conference last year. And the 3 projects that we run, first is Wi-Fi or Parah on the streets, and we go on the streets, we ask questions, we speak on Vox Pops, and just ask people questions. Like the video you saw earlier, I saw a lot of people laughing when they were asking somebody to mention reproductive organs, and some people don't know this, or some people don't even have ideas of their sexual health or what is happening in their body. And the second is press. So press is focused on adolescents, people in school, and religious organizations. So last year, November, we had a project where we went to a secondary school, CMS girls, and we're able to speak to them and give them knowledge on their changing body, just to educate them on the fact that their body is changing and they need to take notes of their bodies changing. We look forward to having this first project more often. So we'll be asking that you support us. If you have any organization you want us to come and speak with or speak in, we'll be happy to do that. And our third is Instagram Live. So we know that a lot of youths are on social media now. So what we do is we have Instagram Lives where we interview medical professionals or people who have gone through these experiences, who want to share their story. So what we do is we interview them, ask them questions, and then we get conversations going from there.
Thank you. Please, if you have Instagram, please follow us on Wi-Fi_official on Instagram and YouTube too, so you can watch all our videos, all our outreach. Thank you for choosing us. And thank you for sponsoring us as well.
All right, once again, before we go, we'll be outside asking a few questions. So while you're on your break, please indulge us and we'll be happy to answer or ask you questions as well. Thank you so much.
Thank you so much, Wi-Fi, and that's the password you just got there. So at about now, we are free to have our comfort break for the next 5 minutes. the conveniences, one to your right once you step out of the hall, and others are at the extreme end. You walk all the way to the end of the hall, and you're going to see the conveniences. And at this time too, I want all of us, SARS and MAS, our special guests, our speakers, to please step to the red carpet for some pictures. Those will be very good for our ops. So we are waiting for you on the red carpet now to step out there. If you want to sit, it's good, but it might do you well too to stretch your feet. You want to stand up, turn to the right, to the left, and ease yourself a little before we convene in the next 5 minutes. And when we come back, we're going to be taking some more awesome sessions, and your questions are going to be aired. Thank you for your time thus far.
That's what he said to do. I found a way to see you. You are the fire I've been waiting for. Do you know? Now my time need you. I dey pray for the day when I can finally kiss you. You know, that's why my heart is a beat like that's why you are so I say I'm more like see, I'm not asking for what to you, but I'll give you what I have. What do I need? That's why my heart is a beat like I say I'm more The grass is greener on the other side. That's what I thought before I took the ride. I burned my bridges, so I never look back. But if I had known, if I was searching for, you'd been me right. If I had known, if I was searching for, was already my own. The grass is greener where you water the ground.
That's what I found when I took the ride. I realized the mountain I've been climbing, nothing much can you. I didn't know I'm ready at the inside. Oh, I didn't know. But I was searching for, was looking me right in the eye. Was already right. I believe in you. Do you believe in me? I believe it's true. If we try, we can be free. You and I, we know it's true. Life is great. Life is blue. It gets darker before the dawn.
Please, may we make our way back to the hall?
When you come
Let's
home,
continue the session. Ladies and gentlemen, everyone, please let's come back to the hall now. Please, ushers, help us alert those who are on the corridor to please come in so that we might take the next session. Ladies and gentlemen, the break is over. Please, let's come back into the hall. We're giving allowance of another 2 minutes, and you might have to come and meet us while the session continues. Ushers, please kindly help me to reach out to everyone in the corridor to come in. So in this session, we are going to be looking at infertility and the needs for knowledge and intervention for older couples. So most of the questions we still have outstanding will be handled during this session, I believe. And there is a very, very capable hand to talk about that. So without wasting any further time, I want to introduce to you the CMD CEO of LifeLink Fertility Clinic. Just a moment, ma. We will be taking the next session. But before she comes up, we need to have a sneak peek into who she is, what she's all about. Please take a listen.
Fertility.
Volume, please. And while we wait for that, we want to appreciate some of our sponsors. We want to appreciate LifeLink Fertility Center. We want to appreciate Kingswell Fertility Hospital, Androcare Fertility Center, Adron Homes, Finch Glow, Ascension, Chemistry, Mrs. Taiwo Fagade. We want to appreciate Mrs. Esther Ajibola. We want to appreciate all Parah partners and not forgetting Mr. Sheyi Fadimo. If we are supposed to appreciate you and your name is not here, consider it that we appreciate you. Let's put our hands together for ourselves. You are all welcome.
Dr. Kemi Ailoje is a reproductive endocrinologist, fertility IVF specialist, clinical pharmacist, and practicing physician. She obtained Bachelor of Pharmacy and Master of Science with distinction in clinical pharmacy from the University of Lagos, Bachelor of Medicine and Surgery, specialization in reproductive medicine and endocrinology from the University of New South Wales, Sydney, Australia, Doctor of Philosophy with distinction in courseworks. She has attended several trainings and seminars on reproductive medicine and endocrinology, clinical pharmacology and embryology in Nigeria, Ghana, Liberia, Sierra Leone, Uganda, South Africa, Israel, Ireland, Italy, France, Austria, Germany, United Kingdom, Canada, UAE, United States of America, and so on. She has various scientific presentations and publications to her credit and has a weekly health column in the national dailies. Dr. Kemi Ailoje is a member of numerous local and international fertility, reproductive, and endocrinology bodies, amongst which are Fertility Society of Australia and New Zealand, Association for Fertility and Reproductive Health, European Society of Human Reproduction and Embryology, Royal College of Obstetrics and Gynecology, American Association of Clinical Endocrinologists, Society for the Study of Reproduction, Society for Assisted Reproductive Technology, Pre-Genetic Implantation Diagnosis International Society, American Society for Reproductive Medicine. Dr. Kemi is also the founder and CEO of Divine Ambassadors Foundation, an NGO enhancing access to health and education, championing the rights of women and children, especially the girl child. She also founded Kemi Ayiloje Foundation for Women and Children's Health Education, Empowerment, and Rights, an organization dedicated to advocacy, education, and empowerment of women, youth, and children, especially the less privileged and disadvantaged. Dr. Kemi is a UN-trained specialist fertility and counselor and has partnered with and consulted for UNICEF, European Union Prime, ALCO, World Bank Project, NACA, and several other states, national, and international agencies on reproductive health and sexuality education, protection, and participation rights. She pioneered and revitalized the anti-HIV AIDS clubs and the UNICEF child-friendly schools in the southwest zone of Nigeria. She has won various notable awards, amongst which is the National Award for Leadership, Efficiency, Accountability, and Professionalism. The This Day newspaper 2022 Health Personality for International Women's Day Award for helping women to tackle fertility challenges and gain access to health care. She is the Chief Medical Director and Chief Executive Officer of LifeLink Fertility, an ultra-modern state-of-the-art fertility treatment center with a great team of highly skilled professionals. She is one of Nigeria's most sought-after female fertility IVF specialists. She brings a unique and vast experience in offering solutions to infertility issues across the globe with a compassionate touch in ensuring a seamless journey towards successful parenthood. Ladies and gentlemen, please welcome Dr. Kemi Ayiloje to the 5th edition of Parah Family Foundation Fertility Conference.
Let's celebrate her as she comes. You are most welcome.
Thank you very much. Thanks a lot. Don't worry about the microphone. They never want to give women voices. We will find it. Somehow we'll find it. We'll find it physically, we'll find it spiritually, we'll find it educationally, and we'll find it in making beautiful families. I want to say thank you to the wonderful Vishna, Princess Odukoya. She shares a dream I share as well, passion for women. To a wonderful, ever-supporting husband, to my professors, they just left, my president and all of that, to a wonderful, calm, amiable, supportive sister, Dr. Ido, the head of the Regulatory Agency for All Health Body. I want to say a big thank you. It's wonderful to have you all today. A lot of our slides they've done, all the titles they gave and all of that doesn't compare to having a little baby, the ageless miracle in your hands. So I'm going to be addressing us as simply as possible. We'll start with the slide, but I don't want to say next slide, please. Once I do this, no, I want my next slide. Thank you very much. So, right. We're going to be talking today about need for knowledge and intervention in older couples. Why are we emphasizing on older couples? These are the people, for some time for women, we think we should look for the money and then the work and all of that. We've seen all of that. Emphasis is on older couple. Older couple being the man and the woman in this instance. So there's a need for that. Infertility has been defined. You know, if you're married and in 12 months of regularly meeting, don't meet when you're not ovulating, then you don't fall into that category. And it affects millions of people. They can be primary and it can be secondary. And age, this is where we're going. Age is a significant factor. You know, it's very disheartening when somebody tells me, I'm 45 and I'm a virgin. Don't tell me my eggs are finished. And that's why sometimes it's very difficult. I miss the very busy schedule. We support Parah because awareness is key. To know that you waited for somebody as a virgin from 21 and you got married at 45 and the first thing the doctor is saying to you, there's no egg, means you were not aware. To know that your parents didn't check your testes and you had undescended testes and you had infertility issue is ignorance. So we're talking about knowledge, simple knowledge. We're not going to be doing a lot of medical stuff. So age for both people is actually a function of infertility. So we've looked at it. Global infertility prevalence, approximately 1 in 6 person. So as we're sitting here now, in every line, there's somebody who's going through infertility. Don't feel bad. There are also people going through cancer. There are people going through every other thing. We're not, this is telling us that life is full of challenges. You just identify yours and try to solve it. So 17.5% estimated prevalence of infertility, which is a 95% confidence interval. So these are studies showing that infertility does exist. Now, what are the causes of infertility? 20% female, 30% male. If you look at it, it's 50-50. So if we're not having a baby, 50% daddy and 50% mom. So there's no better person. If you misbehave, I'll go and marry another woman. No. There's no other woman somewhere. The other woman may not be having infertility issue. She may be having mental health disorder. She may be traumatized. She may be having financial infertility. So she may be barren spiritually. She may be doing every other thing you don't know. So this is just a challenge that we all need to please face. Factors that increase the risk of infertility, we've talked about that. Age, being overweight or underweight. When the doctor says you need to lose weight, but sometimes at the back of your mind, you know that there are big women who actually get pregnant. Your neighbor is so fat and she's getting pregnant. So there are more factors than age, but age is significant. Exposure to radiation. Some of you work in places like this telecommunication masts and all of those radiation, and you feel okay. Some of you are welders, you are cutting the lead and all the iron. So these are simple things that you need to check. Constant exposure, Prof has already talked about that, and other environmental toxins. When a man finishes having a bath with warm water, and even in very cold weather, they should just try and put some cold water to wash out the testes every day. That should be a norm. Wash your testes with cold water morning and night. It would help you even in the sweater. It's difficult to say don't be in a long distance travel. We're all caught up in traffic every day. So I'm not sure a man stands up in the bus every day just to be shaking the testes so it's not hot. When you get home, just cool down the temperature of the testes. It would help. Extreme emotional or physical stress causes even irregular periods. And the stress starts mentally. Like we're looking for a baby, we're looking for a baby, we're looking for a baby. If only young women like the Wi-Fi Foundation, I'm very proud of them, can come out to say, do you know what? It's a new field now. I saw them talking to young girls, the same way we did to United Nations so many years back, to say HIV is not how they described it. So I'm not taking oranges, I'm not. Awareness changed a lot of things. If you realize now people are not talking HIV so much, has it disappeared? No. There's so much awareness that young people will tell you, where is your condom? Girls, they're informed, so they know you want to sleep with me, I'm ovulating. These are, you may not like it as a parent, but it's happening right in front of us. So we need to be aware. Irregular period can happen because you are overly stressed. Even thinking about the man to marry in itself can actually have even marrying a man who is always shouting and shouting, at the end of the day, you're traumatized. Even in the same so-called marriage can affect infertility. So if you compare the egg supply of a person less than 35, you see a lot of eggs there. You can see that. And then if you compare the egg of a person who is older, is actually less. So the question that Wi-Fi asked on one of their screen, and we need to talk about that. I'm interested in young people. They can change everything. They have energy. They have all of that. We were part of that growing up as well, even going to school. The truth of the matter is your egg is far, far older than you are. So if you say my egg is my age, that's not correct. Before you were born, your eggs were formed. And almost half of it is almost gone as a female. So that's why we say women need to have the voice. So to have a woman talk about this thing every time is wonderful. So what are the infertility they think is a female challenge? Women need to maintain a lifestyle, supplements are a helpful way. Fertility is not a problem if you had a previous child. That's not correct. And Professor Tijani had already explained that you could have children and then have varicocele or have torsion or have infections or have anything that can affect your next generation. Some people say IVF is not safe. They actually come to the hospital to say, show us IVF babies. And I said, that's one of them. So this is because you don't have knowledge. You think IVF babies someday, their eyes will twinkle or because they're normal people. It's the same way you go to the US on a flight, or some people went by water when it was their time. So you need to have information. Now, age doesn't affect male and female fertility. I don't need to dwell on that. You've heard a lot about that today. Age affects everything, even affects our money. Sometimes you're so rich you can't spend it because you're old. You can't fly. Your private jet is fat. You have a beautiful house, you can't go up the stairs. The drivers are enjoying the car. They're making the bed so nice. You're just looking at the pictures of the bed. Is my bedroom made? Yes, but you can't go upstairs. You have beautiful shoes you can't wear. So age affects everything. Sometimes you squint. Sometimes you're tired. So all of that is age. So don't envy, don't put it to just fertility and start stressing yourself. Age affects life. At the end of time, when everyone, he says, with your gray old hair. So even God understands that at some point you will have gray old hair. I would be with you till eternity. That's God's word, and he doesn't lie. So if he says you're going to age, you will age. So do something before age catches up. That's why the cliche says, make hay while it's sun. Thank you. Good quality eggs refers to the genetic composition of an egg, ability to produce good egg, but AMA means advanced maternal age, the age where a woman's egg is characterized by poor quality. So it's not now I'm 45, I'm 40, I'm 38, I have money. How about the eggs you're producing? We just gave an example. You have private jet, you can't fly. So you have eggs there. They're always going to be there, but at some point they'll be dormant. About 5 to 10 years before a woman reaches menopause, her fertility would decrease. So if Wi-Fi goes to tell people, while you're looking for Mr. Right, you can keep your eggs for future use, it would have been good. I had a colleague in Australia who was a preserved egg, and he was the embryologist of the time. So if they didn't do that, that child would be gone. The chief embryologist used donor sperm in one of the centers and has twins. She's 54. She had twins from donor sperm, and she did. The only way it worked was because she had knowledge to have kept. Don't come and keep your eggs at 45. It's like keeping old Naira notes. Don't keep your eggs at 45. Let's be practical. Don't keep it then. It's not a good time to keep your egg. When your grandparents show you this is what we used to spend in the time of Shagari, is it useful to you? So why are you bringing it to the doctor? Keep the new currency. In fact, if you have your currency in the bank, it's useful every time. It's online, whether it's £1 or it's £1, is useful. That's what we're talking about, cryopreservation. And that's what the youth needs to know, because they go about talking about infertility. They say, oh, don't make it. No. What's the facts of the matter is what you need to know. I can be old, but if I have eggs there, tomorrow if you hear Dr. Kemi has just had a set of quadruplets, will you be surprised? Why wouldn't you be? You think that she knows, so she has kept her eggs for the future. That's your thoughts. But there are so many other methods of having babies. They say the womb can be weak. If we follow biblical principles, Sarah had her babies in her 90s, but then they used to die at 906, like Methuselah and so on. So who gets to 900? Things have to be comparative, and we have to apply common sense. Now, age factor. Look at the age of somebody who's 22 years. They can actually get pregnant once every four times every year. By the time that same person gets to 42, they can only get pregnant once every 10 months, 5%. So age is a big factor. Right. Now, medical conditions can also make you not be able to get pregnant. Like somebody struggling with, we've had patients who came in just to do IVF, just from examination of their breast. That's the female first thing to do. You examine the female, you examine the male. They have little lumps. Then you send them somewhere to say, this lump, let's check that is not cancerous. And the next thing, they take a little lump, they go somewhere else, they say, oh, the lump has cancer. Now that person is battling for life. They're not thinking about baby. So age can be a factor: diabetes mellitus, stillbirth syndrome, Down syndrome, ectopic pregnancy. Miscarriages happen because of chromosomal abnormality. If the seed is not right, nature will expel it. God is the one that controls population the most. So it doesn't make a woman get pregnant every month. That's why you wait for 9 months. In every 9 months, you're waiting, the body is healing. So these chromosomal abnormalities can happen because the fetal development has issues. So even when you do IVF, say, oh, the IVF was successful. I miscarried at 12 weeks. Check why. That's why PGT is very important, genetic testing and all of that. Pregnancy-induced hypertension. Of course, as the patient ages, the arteries become old. We can't overemphasize the age. There's even an age you can't chase after your children. Just say, oh, those there's an age that they would advise you, and you are just flying up and down looking for knowledge. What are you looking for? But they're the same people that will come back and say, we're so proud of you. So you need to know what you're looking for. If you're looking for a baby, settle down with organizations that will give you information. Pray. At the end of the day, the Lord, the giver of life, is the one that gives children. We have embryos everywhere in the tank. We have people who have babies. Some of those pictures you saw, so most of them were my patients. Some of them have 9 failed IVF cycles from different centers. When they're meeting you, you are meeting with a traumatized person. So what are you going to do differently? I did it here, I did it, I did it, I did it here, I did it. I said, let's do something differently. Let's commit ourselves into the hand of the Creator, the Lord, the giver of children. Then, if he doesn't answer us, we would have done our bit. But I've been praying since. Maybe you're praying grumbling. Maybe you're doing it grumbling, like people who go to library when we're in school, they'll carry big textbooks. Half of the time they're chewing gum, they're reading novels inside the big textbook. You're also in the library, but are you reading? Maybe not. So if we want to be practical, first of all, the reconciliation comes with truth. What do I know? I don't know anything. Then you start reading. People say, how do you read so much? Because I decide this topic, I don't know it. We have to start looking. What exactly are they talking about? So it's the same thing with fertility. What exactly do I need to know? If I have infertility issue, that's not the end of the world. People who have children, who gives them extra millions in their account monthly? So why are you feeling bad? It's the same way. This person lives in this big house. That person's out with you, put yourself under pressure, and all of these would cause stress and age you easily. Manage existing medical conditions, take prenatal vitamins, exercise regularly, quit smoking, stop drinking alcohol, or at least reduce it. Have a healthy meal plans, and then stay within a healthy weight range. Healthy weight range, you know it. When you're overweight, you can start having all of that. Right. Now, common causes of infertility, we already have talked about that. Fibroids, endometriosis, somebody who's had 3 fibroids. It's easy for a man to come up and say, you don't need to have a baby when you're 52. If you don't die before 90, you're going to be faced with 38 years of the same story. So it's God that gives longevity. Find whatever you are going to look for in 10 years, look for it now. Nobody gives the deadline of the ages. Even the doctors talking to you don't know when it's going to be the expiry for them. So find what you need to find when you need to find it. That's the so. Of course, abnormality can happen in ovarian functions. Wi-Fi, I hope one of your representatives is here. We've talked about you giving the right information, not asking people your organ is sperm. No, you're now an ambassador. If you need to participate with doctors who would find little time for you, who would answer questions so that you know you're giving the right information. Now, so if I say, oh, it's okay not to, a man will be 70 and will marry a different wife, and they will have a family, and then I may be left. So disorders such as fibroids and endometriosis and all of that can also affect infertility. The knowledge is a significant thing. You find that even as much as we say it doesn't affect us, we actually have done studies to see that infertility can cause divorce. A lot of tension, stress. Before you know, people are apart. I'm better off at the office than I'm better off in the house. And these are all age-related. I've been with you for 25 years. Why are we still looking for ovulation? Is ovulation missing? So you're wondering, it becomes verbal, it becomes emotional, it becomes very personal to you. So it can have psychological effects, which can eventually affect a company. And these are the sources of knowledge about information. Most women listen to radio. Some of them are herbalists. They want to sell you a product. I have this thing. It can do headache, it can do diabetes, it can do hypertension, it can do, so they have the medication that can solve all of that. Health system staff, school, friends, family, self-learning 11%. And that's where Parah comes in to give all the information. Right. So available treatment options. Prof has said it a lot of times. I agreed with him so many times, apart from the time when he said women should stop at a certain age. We're too emotional to stop. A woman will not till she passes on. So let's look for the baby. Use of third party involves the use of a donor egg, donor sperm, or surrogate mother. No matter, see, it's okay to talk about stuff, but your culture cannot define medicine. In other climes where you travel, you realize that people would still look for a baby. People would will their stuff to cats, to dogs. It doesn't make it normal for us. Africans are looking dog, cat, chicken that I'll kill tomorrow morning. But for them, that's their culture. So we need to know that people will seek other sources to have a baby. Some people would have children. I've just given you an example of an embryologist in Australia. Embryologist, by the way, a specialist who would be doing all the egg and sperm mixed together to form the baby, chooses to use a donor sperm to have her twin babies at the age that she was convenient at having it. So the options, because they have knowledge, and use of a surrogate mother, the professors have talked extensively about that. So we talk about the method of assisted fertility medication, ART, ovulation induction. All of these can happen for a lot of people when they're young. For the older patients that we're focusing on, it's not happening. You are doing all of this in another person, you're only carrying, you're only a recipient. So in an older patient, you're not only doing IVF using your own eggs, you're doing IVF using a donor egg into your own womb. That's a recipient cycle. Right. So what are the interventions? You need to seek counseling. You realize, like, all the professionals have said it. Sometimes you just need to talk. It's not one treatment for everybody. Sometimes when you finish talking to a doctor, you convince yourself, I don't really need this baby that desperately. Am I needing the baby for other people or for myself? Some people would have one baby and be happy. Some may have three and be happy. So what is your capacity? At the end of the day, you need to seek counseling. You need to connect with others through support groups, Parah and all the other foundations that we support. We're happy to do that. Online community, I guess that's what the Wi-Fi wants to do, but the information has to be appropriate. Provide a sense of validation. When you know I can be a virgin, there's something called unexplained infertility. That means a person doesn't even have a problem, but they're not able to get pregnant just yet. And they go on a vacation and they miss their period. You're waiting for them to have a period to come for treatment, and they have it right because their age can still be okay. Older couples may have exhausted fertility treatment and they are faced with age-related infertility. Adoption and surrogacy may also be an option. But at that point, where people are resorting to most of these, the experience we have is that they have exhausted so much. It's okay when you're the first person seeing an infertile couple. When you're the 10th doctor seeing an infertile couple who has done ART 9 times, they bring their financial burden to you. Doctor, please, this treatment, don't let it be expensive. Which one is cheap? Which one is free? Which one is... So you're in between a medical consultation and pricing. And if you're not careful, you'll be biased because you start looking, look, media is X amount. This woman is talking free cycle. You begin to be biased. So your clinical judgment is not straight. So we need to understand that healthcare may not be cheap. It may just be affordable, but ART can also work. So by the time we're chasing after career, we should also take a pause and see if we're able to achieve children alongside or child if we want to, depending on your choice. Infertility in older couples is accompanied by complex challenges that requires a vast range of approach. It includes medical, psychological, financial, and ethical considerations. Enhancing the need for knowledge, promoting awareness, which is what we can overemphasize that, providing comprehensive support for couples struggling with infertility is strongly recommended. Thank you for listening. Next slide. Go on to the next slide. Right. There's a slide. And that's my message for the slide. I know that's right. That next slide is us, practically. Okay. Are we looking for the next slide here? No, the next slide is us. When you have a urologist, male, and you have a gynecologist, professor, who has come here, and you have a reproductive endocrinologist who have been here, don't let it end here as a lecture. Seek knowledge, find solutions, ask questions, speak to truthful people. I said to the president one time, I sat with a woman in a new church I went for. She didn't know me. I could guess she was about 54. She had this set of twins. I just said, hello, ma, and I sat beside her, maybe 54, 55. And she went on and on. Oh, you look beautiful. I said, thank you, ma. Do you sell clothes? She went on. I said, happy Sunday, ma. I really like to concentrate in church. By the time church was over, she told me, you know, these kids, one day I just left and I just got pregnant and I just had them. I said, congratulations. I didn't say to God be the glory because we'll both be lying. And I called her afterwards. I said, tell me how you got these babies. Assuming I was 28 and you're telling me, I said, ma, do you mind? How old are you? She said, I'm over 50s. I said, so how did you conceive these babies at over 50? That's a very big miracle. And then she says, you know, she went on and on and on and on. And I turned and looked at her. I said, well, what I do is IVF. So I'm happy you had these babies by IVF. She looked at me. Sarah, why? Have you done IVF before? I said, yes. In fact, I have quadruplets from IVF. She said, how do you mean? I said, in my hospital. Please don't advise people. It would have been easy if you kept quiet. I would mind my business and leave you. But you're misleading me. You're misleading me to think that if I don't do anything now, so Mr. A comes, please, 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 I still have 20 years. Mr. B will come, oh, please. But you're not helping the young people to tell them whatever. You see, old parents are more, they're wiser. You can think they're not educated. They're wiser. When a woman gets to a particular age, first they tell you, I don't want to see a boy around you. The next time they're telling you, so where is he? Where is he? They know. They understand it. They start pressurizing you. Then your mother-in-law wakes up. Have you noticed father-in-laws don't wake up to trouble you? Your mother-in-law wake up, oh, my grandchildren. She understands and knows the changes that happened in her body for certain things to stop. So when a doctor is even telling you don't have a baby at 54, they're right. The energies have dropped. All of it, well, we have patients who came to us and lied. We did. They even brought ID card. So let's not go into all of that. They got transferred, but the complications, if you're not monitoring properly, would arise. And then they say, doctor, come, I want to tell you something. I'm not 48. I'm 55. I said, okay, that's a good one. We could have talked about that while we were starting. Okay, so how do we go about it? And we managed them successfully. So knowledge is important. Awareness is key. Seeking information is paramount. And talking to the right group of people is what you need. Seek help. Go to proper hospitals. And importantly, don't forget to always leave it in the hands of the Creator and pray as always. Thank you very much.
That's awesome. Thank you so much, Dr. Kemi. And I think the first question came in early. And by the way, as much as possible, let's compact the answers so that we can take a few more and be out of here in the best of times. This is 2-in-1. Radiation from proximity to telecoms mast affects fertility. Question mark. For real? Okay, that's one. Then the second, BP medication impact on erection. Same for diabetes medication. Babies born to age couples prone to disabilities, Down syndrome, etc. Okay, I think these are just situational questions saying impact of BP medication on erection, also diabetes medication, and of course, radiation from proximity to telecoms mast. Do they really affect fertility? And the third is that are babies born by age couples prone to disabilities such as Down syndrome? I don't know if you can run through the three together.
Let's take the babies born to age couple. So, I mean, the question isn't clear. If an older couple is using a donor egg, donor sperm, the babies can be born to them via surrogacy, but the babies will be healthy, just like young couple. Number two, some medications, the pathway of certain medications, for example, medications for blood pressure and all of that, the pathophysiology of the medication, the route of that medication can also cause erectile issues. So most men who are on antihypertensive know what we're talking about. So what's the third question? Mast. Yes, if you look at the mast, go and read the mast agreement. They will tell you all of that. And that's why you see mast are taken far away from the, so don't sit on a pipeline, don't live on a pipeline because the houses are cheap. Don't stay around a mast for too long.
All right. What will you advise an age couple around 60 years old who are still desirous of children and adoption is not achievable?
Old couple, 60, who's 60? A man can be 70 his age, but he could still have kids. Who's the 60-year-old? If it's the female, we have to first of all examine how many 60-year-old women can really take care of children. We need to be realistic. It's commonsensical. 60, by 60, your menopausal, your estrogen is low, you can't wear high shoes, you're wearing block heels, you're having body. Ooh, if you can and you're being examined, you could go to countries that they will do it. In India, they have 70, but it's individualistic. Talk to your doctors. There are even medical conditions that will make you not to be able to carry a baby less than 40. So we're talking about comorbidities and the health status of that particular individual.
All right. Thank you so much. Any other question?
Well, we're waiting for a question. Let me I can't be here and not greet my president, especially Professor Fibai, the president of Association for Fertility and Reproductive Health. A very gentleman, all the way of all our projects, Port Harcourt, everything he's supporting quietly. So Parah, you have somebody good on your plate. Don't let him go. He's a very wonderful person, always ready to support. I said there are men gynecologists that have women compassion. He's one of them.
Awesome.
So please.
Let's put our hands together one more time for Professor.
Professor Fibai is a wonderful person.
Great to have you.
So
We
do we have more
appreciate you.
questions?
Yes, this last one. Can you throw more light on or to OHSS? I don't know what that is.
Ovarian hyperstimulation syndrome. That would only happen if you're stimulated. First, there are features that will make you prone. Some people, the listed features, thin, young, they have PCOS, polycystic. Don't let's complicate it. When eggs are retrieved, it should be between 8 and 12. A good doctor knows it should be between 8, 12, maximum 14, 15. For some people, you can retrieve as much as 40 eggs. A good doctor should have known from the start. You punch 12 holes, and then the stomach has, I'm trying not to use too many medical words. There's retention of fluid, the patient is sick, and at the end of the day, you haven't achieved anything. You can't even transfer to that patient. Parah, your YFA can pick some of this topic, PCOS, OHSS. We could put it online for them to see. It's a big problem with IVF, but it only happens in most times young people who have, or people with hormonal issues. So before you get to that point, OHSS should not exist anymore. Maybe 1 in 100. These are cake topics. OHSS in 2024. How did you get to that point as a clinician? You can cancel a cycle. If you're not desperate, how do you get to OHSS? You can cancel. You can do agonist trigger. There's so many ways not to have OHSS, but as with everything in life, 1% of everything goes the other way. There are also ways of managing OHSS. So if you're doing IVF, you should have a complete hospital. Don't do IVF, just take eggs. Go to a lab scientist, they take your eggs, they put it together, it looks cheap. When you're faced with complications, you look for us. That's what always happens. So that's where you need to have Professor Fibai's contact. He would help you. Right, is there any other question?
All right, there should be some more from the virtual participants, but I'm waiting to get those. So maybe before they come along, we can just move on. And when I have them, I'll make them available. Yeah, I kept missing out on something. For those who are new to Parah Family Foundation Fertility Conference, there is always something to take home by a number of people. I don't know how many people, but it's going to happen today again. I'm not talking of biscuits. I'm talking of ART circles that gets to be taken away for free. How many of you had a lucky dip? You took a dip when you came in. I hope you have not thrown those slips away. And if peradventure, it's someone who doesn't really need it, who has it, I think that person too may have to donate to someone else. So before we leave, we are going to take that tip and know the lucky winners for those sessions. Is that a question for her? All right. Just a moment, please. All right, once again, to say a huge thank you and a word of appreciation all our sponsors. To all our sponsors, Lifelink Fertility Center, we appreciate you. Kingsway Fertility Hospital, Andrew Care Fertility Center, Adron Homes, Finch Glow, Ascension Chemistry, Mrs. Taiwo Fagade, Mrs. Esther Ajibola, Para Partners and Volunteers, Mr. Sheyi Fadimu, and also to appreciate the presence of Mr. Joshua Okorie, Head of Admin, Kingswell Fertility Hospital. Please let's put our hands together to appreciate him. Thank you. Thank you for being here. All right, a question? All right. Okay, so we quickly go to the next we're going to have a short talk in another 2, 3, 5 minutes to enlighten us on some procedures. Just a moment, please. On the regulatory and monitoring policy for fertility centers in Lagos. And like I said, it's going to take circa 5 minutes, 3, 4, 5 minutes, and we'll move to other things. Please, let's make welcome Dr. Idowu, the Executive Secretary, IFAMA, Health Facility and Management Agency. You're most welcome, ma. Okay, some miking up is going there. Please let's put our hands together to celebrate and welcome her. You're welcome.
Thank you. Good afternoon, everyone. At first, I want to apologize for coming late. I had another engagement, but I just wanted to be a part of the discussions because I actually believe in what Princess Udukoya is doing. It is the organization has been very consistent in bringing succor and knowledge to those who suffer infertility. We know what infertility is we know what the importance of children in our culture and the way many people take advantage of infertility. We have a lot of charlatans in the business and they are trying to bring knowledge and succor. So we at a farmer is Health Facilities Monitoring and Accreditation Agency. We try to collaborate and at least encourage her by by being with her in all the things that she does. So I would just say, distinguished guests, colleagues and friends, it's an honor to speak to you today about the important issue of infertility. I won't speak on infertility because I'm not an infertility doctor. I'm going to be talking about what we do as an agency. So Health Facilities Monitoring and Accreditation Agency was empowered by the Health Sector Reform Law 2006 to improve the quality and efficiency of healthcare facilities in Lagos. In discharging our duties, we ensure that health facilities provide quality care, and we're charged with the responsibility of monitoring and inspecting health facilities to ensure that they comply with the standards that we have set. Part of our duties is also includes monitoring facilities that provide fertility care in the state. We all know that infertility is surrounded by misconceptions and societal pressures and demands our focused attention. Therefore, we need to continue to enhance public awareness in gatherings like this to promote early intervention and align with the mission to safeguard and improve the quality of care for all citizens in Lagos State. Knowledge is the cornerstone of fight against infertility, and many individuals continue to remain unaware of the causes, the treatment options available, and the preventive measures which can lead to delayed diagnosis and unnecessary suffering. In promoting a culture of education in gatherings like this, and of course, having open dialogues and discussions, we can continue to dispel the myths and provide accurate and comprehensive information about infertility. As I said earlier, we continue to engage with Parah and all other organizations. We're open to collaborating with organizations, healthcare providers, and educators to disseminate knowledge through public health campaigns, workshops, and seminars. We also know that early intervention is important in addressing infertility effectively, and timely advice and treatment can significantly improve the chances of conception and reduce the emotional and financial burden on affected individuals and families. So our regulatory framework emphasizes that facilities in Lagos are equipped with necessary resources and trained personnel to offer comprehensive infertility services. We enforce strict standards, and we enforce the compliance with these standards that we have set by continuously monitoring to create an environment where individuals can have access to the best possible care at the earliest stage. I just want to say that this event signifies the progress that infertility and those who take care of it, and the treatments and the options that are available in terms of intervention, that there is a progress and there is continued transformation, which will continue, of course, to lead to a brighter future in our community. I want to thank the Parah organization, one, for inviting me to come and speak, two, for continuing to be consistent and continue to provide succor to those who are in need of these treatments and these interventions. And lastly, I was excited when I saw the Wi-Fi. When I heard Wi-Fi, I thought it was the network. And then I see that you have started engaging young children from an early age, and we know that they are the future. They are the ones who can actually bring a change and a transformation to our society, not even only the healthcare space. So I'm just going to say that it's a wonderful thing, and in our own way, as a farmer, in any way you need our support or encouragement, we're here to, work with you. I know that you also have the support of AFRH. Yes, they have done a lot in trying to sanitize the space. The work is enormous. So they need a lot of support from not only the community and not only in enlightening the community, but from organizations. They need, so, I'm really very pleased. And I want to continue to align with Parah. Thank you very much for having me. And I must not be remiss, my dear sister. She has done a lot of work and she continues to blaze a trail, Dr. Iloji. And you are a very good orator. You have to teach me. I'm going to come and you simplify things so much. So thank you so much for having me. Yeah, bye.
Let's put our hands together for Dr. Ido. Thank you so much. Thank you, ma. Thank you, ma. Sure, sir.
Thank you for allowing me to speak. I would like to especially thank Dr. Ido for the job they've been doing. Lagos State is the only state in Nigeria that is properly monitoring what we do. We've tried to enact this across the country, and it's been an uphill task, but it was primarily because of their dedicated work. It took a while, and we worked with them towards developing the regulations that are here. And I dare say that very soon, by the time we get national regulations, it will be from the foundations that were laid by Lagos State. So I want to thank you very much for that. Thank you very much.
You might still hold on to the microphone, sir. I would love for us to take about 6 or 7 questions, all from the online participants. I want them to feel included. So I want us to take all their questions. And I'll be starting with you, Prof, because these questions came in during your session. So I'll take 2 together and I'll await your quick response while we take the other ones. This one says, good day. Please confirm the cutoff age for fertility, because as at 40 years, hospitals are already asking you use donor eggs, as own egg will not be viable. That's one. Then I would love for you to have the second one with that. It says, what's the best method of family planning for a young couple who intends to wait for about a year before conception? Professor.
Thank you. First question was about ideal age for fertility. Not exactly the correct term to use. Fertility differs with each individual. Some people are fertile for very long. A good
person I know got married when she was over 40, and we were initially worried about the possibility of her getting pregnant. But she's had her kids without any issues, without any fertility treatment. So, like I said, we treat you on an individual basis. If you come for assessment, that will determine what would eventually be recommended for you. And there's no absolute cutoff age. Some people become lose fertility early, so you may even have premature ovarian failure at 30 years. So age alone is not the main thing. However, under normal circumstances, if you get up to 35, you are advised to start acting as quickly as you can. For those who are infertile, meaning that a diagnosis has been made and you've tried for up to the 1 year period without conception, the likelihood of you conceiving is not as high as those who had no challenges. For example, a 44-year-old lady came to do IVF because their last child had gone to school and she had tied her tubes at the time. She had no previous challenges with fertility. When we assessed her, everything was normal. We still discouraged her because of age, and I'm sure she mentioned all the other challenges, abnormal children coming from old eggs and all that kind of stuff. But she insisted and went ahead with the treatment, produced excellent embryos, got pregnant, had a normal baby. Doesn't always work that way. We even have some close people who conceive late and have children with a few challenges. So you need to balance everything. And the ideal thing is that you are assessed on an individual basis to determine what is appropriate for you.
Best family planning method for a young couple still wanting to wait.
Any couple looking for family planning would first of all visit the clinic. The characteristics of the woman would determine a lot. For example, one method may be good in you because you have a certain build, whereas another may not be good enough for you. One of the common things we advocate now is the subdermal implant. So you have a small rod that is put under your skin and it affords you little you don't have to supervise much, very effective. But if you are fat, it is not recommended that you should use such a method. The intrauterine contraceptive device is one of the easiest things to put in, and it is easily removed. But not everyone is suitable for it. So ideally, see the physician or the family planning person, they assess you, and then they determine what will be appropriate for you. Thank you.
Thank you so much, sir. If there are any questions to your direction, I will let you know. This one goes to, I'm just using my discretion to direct the questions. This one goes to Dr. Kemi. It says, please, my question is, how can I connect to a good IVF center in Nigeria? My 2 tubes were removed due to ectopic pregnancy. I have tried IVF twice, but failed. Then the second is, what is the solution to delayed ejaculations? So we'll take those 2 questions together and run. Do you want to run over the questions again? Yes, the first, you got the first, the tubes are blocked. And then what is the solution to delayed ejaculations? Yeah, that's exactly how you wrote it.
For the urologist, there's so many factors. Let's start with the delayed ejaculation.
Okay.
There's so many factors. Some men pride in the fact that they think they can count sometimes before they ejaculating. But for sickle cell patient, there could be history of priapism. That means they just have erection and they cannot have ejaculation. So there are medical conditions that can cause it. The use of medications like Viagra, sildenafil can also make you not ejaculate. Looking for a proper IVF center, I think they can speak to Parah so that they can guide them depending on what the issues are.
Absolutely. Thank you so much. You still have the microphone, ma. This is, does abortion reduce fertility? That's one. Sir, okay, ma now. Can roots and herbs heal infertility for couple? 1, can abortion reduce fertility? 2, can roots and herbs heal infertility for couple?
It's a 2-sided question. Abortion in itself, when properly done or for therapeutic reason, should not affect infertility. The fact that the person was pregnant meant that they were fertile. But if abortion is not properly taken out, abortion, we're not talking about spontaneous, we're not talking about abortion going somewhere to take out the baby. There are medical abortions, therapeutic, where the doctor needs to take out the baby so that they can save the mother. If it's properly done, sometimes in 3 months, 2 months, the patients are pregnant again. And it depends on the age. The second question is, but then let's talk about abortion causing adhesions. If it's not properly done or if the womb heals with scarring, it can affect fertility in the future. So we need to know herbs. All medications are herbs, but you need to do everything in moderation as with nature. So what are the doses of your herbs? If you take too much of it or too little of it, you have side effects. There are certain herbs that you could take and you'll be having periods for more than 10 days in a month. We know them. There are certain herbs that people insert and their wombs will close up. So if we don't have the dosage of anything, then we shouldn't take it. It's like somebody telling you, close your eyes and you open your mouth and put a poison. What's the dose? At least we know when we take paracetamol, 6 tablets in one day, 2-3 times daily. If we don't feel good, we go to the doctor. In herbs, I could decide to drink as I'm thirsty, or I could decide not to drink enough. Dosage is an important part of medication. So I'm not really saying herbs don't work. Herbs in doses may, but I would not say herbs would for fertility. What are you really using the herbs for? The causes of infertility is so much. You can't use herbs to open a tube that's blocked. You can't use herbs to do IVF. So what kind of herbs? That question is, I'd rather say just don't. Do something that's scientifically proven because it's also about your life. You don't know the side effects of herbs. At least you know the side effects of paracetamol. So let's know the side effects and do things.
Thank you so much, Ma. This one says, can a woman use her own and donor eggs at the same time? Looks like she's asking if she can use her eggs and donate at the same time.
No. That's a parallel cycle.
Okay, maybe I read the way she wrote it.
I
Maybe you
understand
can
the question.
decipher
Yes.
better.
Sometimes between the age of 40 and 44 or 45, some women can still give eggs. I've had patients 45, 1 egg, 1 fertilization. She had a son. She used donor afterwards and she didn't get pregnant. So that's why we keep saying 1 cup doesn't fit all. Go in for an assessment. There's a 47-year-old who got pregnant naturally after 3 failed IVF cycle. These things happen, but it's in 1%. Are you waiting till you're that 1%? How do you know you even fall into the category of 1%? So what the question is, sometimes when you're between the brackets of the 42 and 44, the doctor knows that you actually may be able to produce your eggs. Look at this. You sitting and looking at me, you're 1 egg. Me talking to you, I'm 1 egg. So if a 40-year or 42-year-old has got the ability to give you 3 eggs, don't discard them. But sometimes in IVF, they don't fertilize. Sometimes in IVF, they don't implant. So it feels like, doctor, why didn't you tell me? So now, while you're preparing that patient for their own eggs, centers, good places have eggs already frozen. They would match you up with eggs frozen or eggs that are newly collected to say, if your cycle fails, we would do this backup. I mean, if the light goes off here, we have backup. We're not going to be in darkness. So that backup helps you to be proactive as a clinician. If your cycle doesn't work, we're not starting all over again. Remember that IVF is paid from out of pocket. So you can't tell me millions have failed and you don't have any solution. The patient will look at you like you're not serious. So using own egg and backup egg is a possibility with consent, and it may not be in the same cycle. Because in every cycle that you're able to produce your own eggs, you don't need a donor egg. In every cycle you're not able to produce your own egg, you may need a donor egg, which means you're just preparing sideways. If you have a birthday celebration, you would have a generator. You may not need it. You rent it. You still have to pay for it. But it's cheaper than not passing wires across your guest. I'm sorry, your NEPA. You're not just knowing that NEPA will do their NEPA thing. So it's about getting prepared. So because when the same cycle of their own fails, the patient will turn around to ask you, so what next? Is that what's next that's making you prepare for eggs for them in the same cycle and is usually cheaper? Do you have more?
To more clarity to the question, which is supposed to mean that can the person use her own egg at the same time with a donor egg, right?
Just answer the question.
So, okay.
Can I borrow a loan when I have money? Yes. Please.
Okay, she wants to expatiate on it. Yes.
if you want to transfer, can you transfer a fertilized own egg and fertilized donor egg at the same time, making two embryos but with different donors?
If a person has achieved fertilization with their own egg, please give them that chance. Except the patient is insisting and there are conditions for that. Because by the time it's not, there's no to it, but if you have fertilized one embryo, remember that embryo can split. We have pictures of splitting triplets. One embryo can turn to 3 babies. What exactly are we looking for? The reason people agree to donor, why would I go and borrow money when I have enough to spend? The reason people agree to donor is a backup. But in the same cycle says, okay, you have now backed me up. The natural, ethical thing to do is to transfer the own embryo to them and freeze their backup. Remember that the backup is also their husband's sperm. So if that succeeds, fine. If that fails, you have something to transfer. But there are medical indications why we could do the parallel cycle of what she's talking about. It's not open for discussion here. Right. Yes, that patient must have
All
that
right.
indication.
Okay, this last one before you take the weight off your feet. It says, can a woman increase AMH? I believe you know that. AMH level before IVF? If yes, how?
Okay, we preach healthy lifestyle, and I keep saying age is a significant factor. When you have retired, you can't go to a ministry to collect salary. You know, let's be realistic. You have retired, they've done retirement, which is the age factor. Now you're telling me AMH. AMH is the single most reliable predictive factor, but it should be done at 2 or 3 intervals because some labs don't know what they're doing too. So if you have done AMH in a proper center and the AMH is poor and is low, seek other options. Otherwise, you just be a guinea pig from one lab to the other doing various tests. The money for the procedure would have finished while somebody is trying to convince you that if you dip, you haven't kept money in your pocket, but somebody is telling you if you dig your hand down the pocket, put it inside and go down, you will find money. You're deceiving yourself. And the worst thing you can do for yourself is to deceive you. People can deceive you. They can take your money, they can plan IVF and not give you, but don't deceive yourself. If your AMH in too good, the same center you went to and they say you don't have HIV, how come when they tell you you have low AMH value, you start binding them? So if the AMH is low, the options. See, the problem we have is we don't believe that problems have solutions. If it's raining, get an umbrella. When AMH is poor, the AMH even explains to you poor predictive value for fertility. Once you get to that point, please seek help. There's nothing wrong in using donor egg. Let's get it straight. The husband you're married, you didn't conceive him. There's nothing wrong. Let's just stop this stigmatization. Give me a minute to address this crowd, please. I did not carry my husband in my womb, and I'm loving him. I'm having children for him. So why can I not take eggs and put in my womb? Half of us here were wearing wigs, we're wearing clothes. Are you part of the cotton that they use in making the material? Sometimes you need to be realistic. What do I really want in life? Sometimes you have children that are not even biologically yours who are kind towards you. You didn't carry them in your womb. They are supportive. You have children who are everywhere just living their selfish life. Sit down, ask yourself truthfully, what do I want? Connect yourself to people who can support you. Don't come and be looking at Dr. Kemi, looking at me funny. I'm not here. Tomorrow, if you see me, you won't recognize me. All of this is gone. I'm in theater doing surgery. I'm not here to give you a show off. I'm here to help you, feel among you, and give you solutions through Parah Foundation because I believe in what they're doing. From them, there was a couple I came in 2 years ago. I thought they were grandparents. I looked at them and I looked at her. But they're pregnant with us now. They are young people she has sent to me. We're struggling. We're giving them all the options. It's not happening. So if I compare that woman who is going to be carrying a baby in her hand, and that has happened over the years. I've been in this conference from the time that she has invited me. We've had free cycles, especially given to older couples who have successfully. Let me tell you a particular patient who was 55. By the time she came to us for IVF, she was 52. By the time we had embryos that was labeled in their name, are we going to throw it away? No. By the time we were giving it to them, they have twins. So am I comparing that to a 31-year-old who is having infertility issue? No. It's individualistic. Go to a sincere doctor. If they have to hold your hand to pray for you and say, go home and adopt, please do. Don't stay with somebody who's lying to you. Adoption, surrogacy, donor egg, donor sperm, donor embryos. Sometimes people finish, from Parah, she's there. Patients come to us at 45, have the baby's first daughter, 5-year-old. By 50 twin boys, they now have 5 embryos. We donate with their consent. So in their age, they completed their family. They even give to other families. You're here complaining about, I don't want donor egg and donor sperm. Is your husband your sibling? Is your husband your blood? They're all people. Are you Israeli? Are we not Christians? Are we from Saudi Arabia? Are we not Muslims? Look, come to the point where you sit back sometimes and say to yourself, a plate of spoon can do me for the morning. I don't need to have a buffet. A plate of meal can do me for the whole day. Know yourself, have knowledge, and then pursue your dream. You're not going to live forever.
Let's give it up for Dr. Kemi. It got as real as it can get. All right, the next 3 are directed to Parah, and one of it is a commendation. So one of our online participants, probably asking on behalf of the others, was saying, how will those online participate in the Lucky Dip? Okay, I had something that was not said. OYO. Okay, don't worry. Just make sure you make your way here when we are having the next conference. This might not be possible. That's the feedback I'm getting. And this one says, can we have the names of fertility centers and their contacts? Like Dr. Kemi said, reach out to Parah Family Foundation and you have a list of the very, very reputable centers where you can have solutions. And Dr. Enna Onikoyi says, warmest thanks to Mrs. Odukoya and the Parah Family Foundation, and of course, the Board of Trustees. Wonderful and exciting presentations, especially by Dr. Kemi Ailoye. Continued blessings, Dr. Mrs. Enna Onikoyi. Thank you for that word of commendation, which I know is not far from what I'm getting from people who are seated here as well. I believe we have got value today. And for us to round up the session, there is a virtual session we'll be listening to now. And it also promises to be impactful. Yes, are we ready? Okay, so we're going to be looking at dietary and lifestyle changes to enhance fertility. And to take that is Tony Akinyemi, who will be joining us virtually. Is the founder of Rafa Institute of Healthy Living. Please, let's take a listen.
Tony Akinyemi is arguably the pioneer holistic health coach in Nigeria. He has been sharing his holistic healthy living message for close to 2 decades now. Reverend Tony Akinyemi has 23 published books to his credit and is also a writer for many magazines and newsletters. His passion for teaching healthy living principles was born out of his desire to help people prevent or reverse various so-called incurable diseases, having recovered from a debilitating disease himself. Tony Akinyemi has earned 3 certifications in 3 different fields and has tremendous experiences in all 3 fields, spanning several years. He is board certified as a holistic health practitioner by the American Association of Drugless Practitioners. Tony Akinyemi pastors the Shepherd's Flock International Church with headquarters in Ikeja, Lagos. The Reverend Tony Akinyemi is married to Tutu, a chartered accountant and an MBA degree holder, and they are blessed with 3 great children, a medical doctor, an economist, and an engineer. Ladies and gentlemen, Please make welcome Dr. Tony Akinyemi to the 2024 Parah Family Foundation Annual Fertility Conference.
There are objectives that I have in view. I call them our learning objectives. At the end of this presentation, we would have learned about infertility in men and women. We will have learned about the causes of infertility in both genders. We will look at 6 steps that are very critical to conception in humans. And then we will look at the need for early intervention whenever there is delayed conception. And then we will conclude with some dietary and lifestyle suggestions to those who are looking up to God and believing God for the fruit of the womb, things they can begin to engage in as far as their diet and their lifestyle are concerned to enhance fertility. Now, let's start with the preamble. First of all, we all know that infertility affects a number of couples in our society. It's not limited to Nigeria. Almost every country in the world, people experience infertility or fertility challenges or delayed conception and what have you. And infertility, if not properly handled, or delayed conception, not properly handled in families, can actually bring undue pressure on marriages and may even break marriages if couples do not learn how to deal with it with the grace and the wisdom of God. Now, infertility, I must underscore, is a couple's challenge and not just a woman's problem. Unfortunately, in many quarters, infertility or delayed pregnancy is viewed as the problem of the woman, but it's not like that. It's a couple's challenge and not a woman's problem, because infertility may be due to the man, it may be due to the woman, it may be due to both of them, and sometimes it may be due to unknown factors. So the question then arises, who is responsible when there is infertility in the family? Is it the man or the woman? Well, science says that 1/3 of the time, infertility is attributable to the female, and 1/3 of the time, it is attributable to the male, and 1/3 of the time, it is attributable to either unidentifiable factors or to both partners, the male and the female. Now, some statistics regarding how infertility progresses with age will then make us understand the need for early intervention, which is one part of our conversation today. All right. Now, so conception rates for normal, healthy couples are at best 20 to 25% per menstrual cycle. What that means is that if a woman goes through a monthly menstrual cycle, there is a 20 to 25% chance of getting pregnant if she has sexual relations with her husband, all right? So conception rate for normal, healthy couples, not those who are having challenges, but those who are considered to have no problem whatsoever about conception. 20 to 25% chance of getting pregnant in a menstrual cycle, all right? But once a woman reaches the age of 35, her fertility potential begins to decline. And by age 40, it is estimated that her conception rate is now in the range of 8 to 10% per menstrual cycle, all right? And by the age of 43, the pregnancy rate is thought to be as low as 1 to 3% per month. And that's why it becomes imperative for early intervention whenever there is any suspected delay in pregnancy. Now, typically when a couple just get married, scientists will expect them to try for a baby for at least 12 months consecutively before they begin to seek for help, all right? So after 12 months of staying together under the same roof, sleeping on the same bed, and making sexual contact, okay, with each other, if after 12 menstrual cycles have run by and pregnancy did not occur, then it's time to begin to seek for help and intervention. And for pregnancy to occur, between a man and a woman, there are at least 6 steps involved. First and foremost, ovulation. A woman's ovaries must be able to release at least 1 viable egg as a first step towards achieving conception or pregnancy. Number 2, the fallopian tubes of the woman must be patent. What does that mean? It means that it must not be blocked. The tubes must not be blocked. When the ovaries release the egg into the fallopian tube, the egg must be able to travel down the fallopian tube, and the sperms of the man must be able to travel up the fallopian tube, and both of them will meet in the tube, and the rest will then follow. That's the second thing. So the first one is the woman must be able to ovulate and release at least a viable egg. The second step is that her fallopian tubes must be patent, that is unblocked, all right? And then number 3, the man must be able to ejaculate. In other words, the man must be able to gain erection, penetrate his wife, and ejaculate sperms into her. That is one of the 6 steps towards conception. And number 4 is that the sperms that the man ejaculates into his wife must be able to travel to the fallopian tube. In other words, the sperm must have motility and mobility. It shouldn't just sleep. They shouldn't sleep where they were dumped. They should be able to travel all the way through to the tube and meet the egg there. And number 5 is that the morphology of the sperms must be such that they are viable. There is no deformity, and they are able to achieve fertilization. The sperm must be able to penetrate the egg and fertilize the egg. That's number 5, sperm morphology and ability to fertilize. And number 6 is that the fertilized egg must be able to travel down the fallopian tube and be implanted into the womb. So the fertilized egg must be able to attach to the inside of a receptive uterus. In other words, successful implantation, and then be nurtured by the body of the woman to allow the fetus to develop and grow until it is ready for birth. Let me run through the 6 steps again because it is critical to our conversation. There must be ovulation, the release of egg. The tubes must be patent. At least 1 tube must be open and allow the egg to flow through. Number 3, the man must be able to produce viable sperms and be able to gain erection and penetrate and ejaculate. Number 4, the sperm that is deposited must be motile and mobile. They should be able to swim to go and meet the egg in the fallopian tube. Number 5, the sperm must be healthy. They must be viable. They must be able to penetrate the egg, fertilize the egg, fuse with the egg. And then number 6, the fertilized egg must be able to travel down and be successfully implanted into the womb. These are the 6 steps involved in natural conception between a man and his wife. Now, if there's a problem with any one of these 6 steps, then that will result in inability to conceive or infertility. Now, so let me now do what I call a head-to-toe analysis of the woman to look at these 6 steps that I've looked at and how they can impact on conception or fertility. Now, let's start with the head of the woman. 2 things in the head of a woman will influence her fertility potential. Number 1 is the amount of stress, her mental health, the amount of stress she's carrying in her mind, the thoughts in her mind, and how under pressure she is. Unfortunately, many men and indeed extended family members don't understand this fact, that when a woman is put under undue pressure, particularly when everybody is asking her, what's going on now? When are you going to get pregnant? Are you the one delaying? Why are you not conceiving? And all of that. When you put a woman under pressure, you scatter her head, so to speak. All right? And that reduces her fertility potential. But if a woman is at peace, if a woman is calm, if a woman is at rest, if a woman is not agitated, then she's in a better stead to be able to do the needful, to be able to ovulate, all her hormones to be normal, and things to work out well. So stress or undue pressure, which normally affects mental health, psycho-emotional health, they play a part in the fertility potential of a woman. In the head of a woman also, anatomically, there can be certain tumors that can begin to develop in the brain of a woman, particularly in the pituitary gland in the brain. And once those benign tumors, non-cancerous tumors, develop in the pituitary gland, they begin to affect the hormonal profile of that woman. They set the hormones of that woman out of whack, out of balance. And once there is hormonal imbalance as a result of these benign tumors in the pituitary gland, that can also affect the fertility of a woman. And so today we'll be looking at how diet and lifestyle can help to minimize stress on the one hand, and also to prevent the development of these benign tumors in the pituitary gland. Or if they have already developed, how to address them so that they can, melt away as it were. Now, the next part of the woman to look at is her neck. If you look at the neck of a woman, there is a butterfly-shaped gland at the base of the neck that is known as the thyroid gland. When a woman has a thyroid disorder, it will impact on her fertility potential. All right, things like low thyroid or hypothyroidism, or high thyroid or hyperthyroidism, or thyroiditis, that's inflammation of the thyroid, or thyroid nodules, or thyroid cancer. Anything that impairs the function of the thyroid can also affect the fertility of a woman. Again, we're going to be looking at dietary and lifestyle choices for your thyroid health towards the end of this presentation. Now we move from the neck to the torso of the woman. Now, if you take the head and the neck off, and you take the legs off, take the hands off, whatever is left, that's the torso. Now, in the torso of a woman, a number of things are going on there that can impact on her fertility. First of all, her hormones. So there are hormonal factors, there are ovarian factors, there are peritoneal factors, there are uterine factors, pelvic factors, medical factors, and even genetic factors. All of these can impact on a woman's fertility. And I'll take them in turn. Now, for hormonal factors, if a woman has hormonal imbalance, such as high FSH, FSH, by the way, is follicle stimulating hormone. If the FSH of a woman is very high, it's a signal that she's probably in menopause. If a woman has too much estrogen, that's called estrogen dominance. That's also going to set things out of order. If a woman has high prolactin level, that's called hyperprolactinemia. That can also affect ovulation. It can affect her fertility potential. If a woman has low progesterone, she may not be able to sustain a pregnancy to term. She will be having miscarriages about the 8th, 9th, 10th week of pregnancy due to low progesterone level, because progesterone is that hormone that relaxes the muscles of the womb and will not allow it to contract and threaten that pregnancy or cause an abortion. All right? So hormonal factors. Again, your diet and your lifestyle will impact on your hormonal profile. All right? Certain things you eat can set your hormone out of range, and certain things you eat can normalize your hormones. I'll be talking about how to balance your hormones with diet and with lifestyle. All right? So that deals with hormonal factors in the torso. Then we have ovarian factors. The two ovaries in a woman. A woman comes from heaven to the earth with about 400,000 eggs in her ovaries, okay? That is her ovarian reserve. But as she goes on in life, things can happen to the ovaries.
Please pardon me to butt in at this point in time. If you will agree with me, a number of things we are hearing now, we've heard it from some of the earlier facilitators. So if you don't mind, we have looked through the video and we are going to continue from a point where it seems fresher than what we have heard before. So you're not going to lose any value. There's nothing lost here. Like you agreed, a lot of these things we have heard before. So we're just going to push it a little forward. Plus the fact that we don't want to keep us here beyond time that is decent. We want to live here in a very good time. So any moment from now, the technical team will take us to that point which we have identified already, and we'll start listening to it from there. And in another 15 minutes, I think the session on this should be over. And then we'll have our lucky dip. Oh, I don't know who is gearing up to be the chosen one. All right, it can be you. It can be you. It can be you. It can be anybody. All right. But this has been a tradition for Parah Family Foundation. At events as this, such freebies come up and people have benefited from them. Imagine someone who is doing the very first ART and voila, that is it. All right. Or you imagine somebody who has gone through many failed cycles and this one, that is a one gift and it happens. Anything can happen. And that is why we believe that your testimony is next. And bear in mind too that we all cannot win that. But for whoever wins, remember Dr. Kemi and many other people talked about our state of mind. Whoever wins, just be happy for that person. Because one of the things I've come to realize is that when God is blessing your neighbor, it's an indication that God is in your neighborhood. So you are the next to testify. You are next in turn, all right? But all the same, keep all hopes high because the dip is going to come and someone is going to win. Technical, are we good to go now? Thank you so much.
It is not my fault. It is your fault. At the end of the day, what does that earn you? What benefit does that earn you? Like I said, it's not the wife's problem, neither is it the husband's problem, but it is the couple's challenge. See it as our challenge. And both of you should confront it together. Don't play the blame game, all right? And then don't give in to toxic emotions. Don't get anxious. Don't get worried. Don't get worked up. Don't get afraid. Don't get envious of those who are giving back to babies left, right, and center. Don't harbor unforgiveness, bitterness, resentment. All of these things will screw you up. That is the lifestyle aspect, okay? Forgive and forget. Also make out time for recreation and relaxation, okay? That has a way of making your body able to do what God designed it to do. Stress, tension, conflicts will screw up the body. But recreation, relaxation, adequate sleep will help your body to reset. And then your body can do what God designed it to do. You can ovulate properly, your hormones can balance properly. Now, how do we boost our fertility potential? Number 3, address any benign tumor in the brain, particularly in the pituitary gland, if it exists. Okay, now that has to be, of course, checked by your professional, your doctor. If it is found that there is this benign tumor in the brain, there's a dietary approach that can help you to melt that tumor away. Of course, there's also a medical approach to that. It all depends on which approach you want to adopt. But I'm talking about the dietary and lifestyle approach here. Now, I have developed a plan, which I call the 30-day challenge, which is a lifestyle and dietary plan, okay? I have a video of it on YouTube. If you go to the search engine in YouTube and you type in there, expose with Tony Akinyemi, the 30-day challenge, it will bring it up for you. You can watch that video. And if you want a copy of the printed or the electronic text version, you can send me an email to tony@tsfchurch.com. And I'll send you a text version, okay, a digital version by email. All right. Now, the 30-day challenge tells you what to eat for breakfast, what to eat for lunch, what to eat for supper, what to take for snacks, and then other lifestyle issues and what to avoid in your diet. All right. Your exercise plan, your sleep, your water, and so on and so forth. When you follow that plan, it has been found to be helpful in shrinking benign tumors, including the one in the pituitary gland that can set your hormonal profile out of order. It has been found to also help to reduce inflammation in the system. And then those who want to melt benign tumors in the pituitary gland should also consider increasing the amount of raw food that they consume. When I say raw eating, I'm talking about raw vegetable juices, not pasteurized juices, raw, homemade in particular. So you need to own a juice extractor at home, juice cabbage, juice carrot, juice beetroot, juice tomato, and juice cucumber, juice lettuce, juice all those vegetables and drink them. That's raw food. Or vegetable salad, that's raw food. Or smoothie, that's raw food. Or raw nut milk, like coconut milk, almond milk, tiger nut milk, that's raw food, all right? Or any raw fruit in season, particularly the berries. All of these things, when you eat approximately 70% of your food raw and not more than 30% cooked, then you stand a good chance in shrinking these benign tumors, in reducing inflammation. And then you can take supplements such as vitamin B12, such as omega-3 supplements like fish oil, like cod liver oil, like shark liver oil, like flaxseed oil, like chia seed oil, like krill oil. All of these are omega-3 oils, and they can help in shrinking, in reducing inflammation. And then you can take turmeric tea with coconut milk and a pinch of black pepper, okay, and sweeten with either stevia or date or honey, all right? And then CBD oil has also been found to be very helpful, particularly in shrinking these benign tumors. Now, the fourth layer in boosting your fertility potential naturally is to address your thyroid health. Don't forget, we started with head to toe. Now, the thyroid has to be fixed. And how do you go about that? First of all, if you already have a thyroid issue, you've been diagnosed with hyperthyroidism or hypothyroidism or thyroid nodules or thyroid inflammation or whatever nature the thyroid disorder is, the first step is to avoid what we call goitrogens. These are foods that are contraindicated for those with thyroid disorders. That will include the cruciferous vegetables like cabbage, like broccoli, like cauliflower, like kale, like Brussels sprouts, all right, like turnip. These are all cruciferous vegetables. They are considered goitrogenic, okay? But if you don't have any thyroid problem, they are fantastic, okay, for you, because they contain substances that actually prevent, certain female cancers like breast cancer, like uterine cancer, ovarian cancer, and what have you. Also, avoid unfermented soy products, but fermented soy products are okay. I will also suggest that you avoid genetically modified foods, GMO foods, okay? Now, so that will help you in dealing with your thyroid health. As well, you must also avoid the halogens. If you did a little bit of O-level chemistry, you will have been taught that the periodic table in chemistry, group 7, all the elements in group 7 are referred to as the halogens, and they contain chlorine, fluorine, iodine, bromine. All of them end with in. Okay, they are called the halogens. All the halogens are toxic to your body, particularly to your thyroid, except iodine, which is a nutrient for the thyroid in particular. So you have to avoid chlorinated water. I will also suggest very strongly, if you have thyroid issues, avoid fluoridated toothpaste. That is fluoride toothpaste. Avoid fluoridated water and avoid bromate in baked products if you have a thyroid issue. And that thyroid issue is impacting on your fertility potential, then you need to avoid those halogens. And then take appropriate supplements to nourish your thyroid. There is a supplement made by a company called Nature's Sunshine. It's called Thyroid Support. They have another one called Thyroid Activator. And then you can find on Amazon.com or SwansonVitamins.com, and you can find other supplements like Thyroid Glandula, okay? And then some minerals like selenium, like zinc. These are particularly very good in nurturing the thyroid to bring the thyroid back to normal. Then you consume iodine-rich vegetables, vegetables that are rich in iodine. By the way, tomatoes, grapes, pineapple, all of these, garlic are supposed to be rich in iodine if they were grown on the soil that is rich in iodine. But if the soil they were grown in was not rich in iodine, then there is no iodine in them because they suck the iodine actually from the soil and store it. If you can't get iodine-rich tomato, iodine-rich garlic, iodine-rich onion, and pineapple and what have you, then you can buy sea vegetables like spirulina, like chlorella, like blue-green algae, like modifilan, like brown seaweed, like kelp. All these are sea vegetables that are rich in iodine, okay? Or you can buy iodine supplements. Iodine supplements like energy iodine, like iodoral. All of these are supplements available. And then make sure that overall your diet is healthy. That helps to prepare your body to be ready for pregnancy. Then number 5, balance your hormones. Boost ovulation. And for the man, boost your sperm count. So how do you balance your hormones? The first step is to avoid hormone disruptors. What are hormone disruptors? Anything that can throw your hormone or your hormones out of balance, such as plastic. Don't eat in plastic bowls. Don't eat in styrofoam take out or take away bowls that they use in fast food that looks like foam. That thing is highly toxic. Don't eat in them, particularly hot food. So avoid plastic, avoid hormone-laden food. Number 1 hormone-laden food that I know of is cow milk, because those dairy cows are injected with hormones to boost lactation, their milk production. And the hormones are present in the milk. And if you already have hormonal imbalance, you don't want to take additional hormones from cow milk. So I would suggest you avoid cow milk, okay? And settle for plant-derived nut milk, like tiger nut milk in particular, is very good in balancing sex hormones, your estrogen, your prolactin, your progesterone, your FSH, your LH, and what have you. To avoid hormone-laden foods, and even poultry products that are injected with a lot of, hormones to grow them and make them big. Avoid those. Avoid foods that are grown with pesticides, okay? Because those pesticides sometimes act as hormone disruptors. They dabaru your hormone. And then certain cosmetics, you have to be very careful. Certain cosmetics that you put on your skin, even on your hair, they have a way of finding their way into the body. They can damage kidneys, they can damage liver, they can disrupt your hormones. They can serve as hormone disruptors. Some of them can serve as xenoestrogen, artificial or synthetic estrogen, and give you estrogen dominance. And then after you have avoided hormone disruptors, the next thing is to consume hormone balancing foods, such as avocado pear. That's why I have the image of avocado pear right there, okay? It's a hormone balancing food, all right? Eat at least 1 avocado a day. And you can make a smoothie by blending avocado pear with tiger nut milk and add a little ginger, a little garlic, and then some banana to thicken and sweeten, all right? That's a fantastic smoothie for hormonal balancing, particularly your sex hormones. And then you can use supplements also to balance your hormones, such as chasteberry or Vitex, energy iodine, balanced woman cream, wild yard cream. All of these help in balancing hormones. Then for the woman also, you need to unblock your fallopian tubes if they are blocked. Normally, they conduct a test that they call HSG to see whether the tubes are patent or not. If the tubes are blocked, there's also a very high tendency that there may be urinary tract infection, either bacterial infection or yeast infection, and that's why the tubes are blocked. So 2 things you have to do. Number 1 is to address the UTI, urinary tract infection, by taking fruits such as cranberry. The active ingredient in cranberry is D-mannose, or you can buy them in capsule form as supplements, cranberry capsules or D-mannose capsules. You can also buy the supplement known as Yeast Defense Essentials. It contains things like olive leaf extract, caprylic acid, okay? These are things that can help to address yeast infection, particularly in the urinary tract, and help to, address whatever infection may be there. After dealing with the underlying root cause, which is the infection, the next thing is to now use proteolytic enzymes and chelating agents. Proteolytic enzymes are protein digesting enzymes, like serrapeptase, serrazine, papain, bromelain, what have you, EDTA, DMSA. Now, papain is from papaya. Serrapeptase is from yeast, and then bromelain is from pineapple. These are enzymes that are extracted from your regular fruits, all right, and food. And you take them on an empty stomach, they go into the fallopian tube, and then they begin to digest whatever it is that has blocked the tube, and they can actually open the tube up. EDTA is a chelating agent. DMSA It's a chelating agent. Of course, you will need a professional to guide you so that you don't, self-prescribe. Then you can, if the tubes are such that, they cannot open up anymore or they are damaged one way or the other, then you can bypass the fallopian tubes by using ART, assisted reproductive technology, such as IVF. In the IVF procedure, you don't need the fallopian tube. You just need to get the eggs from the ovary, get the sperm from the man, fertilize the egg, and then implant the egg, the fertilized egg, into the woman. So the fallopian tube is bypassed when you do IVF. All right. Now, the seventh thing to boost your fertility potential, particularly as a woman, is to address factors such as fibroids, adhesions, that's Asherman syndrome, or endometriosis. Again, proteolytic enzymes can help with adhesions. Then I have a fibroid plan that I have put together, natural things to eat, things to avoid, supplements to take in order to let fibroid melt away, depending on the size. Okay, you can again send me an email to tony@tsfchurch.com, and I'll be glad to send you my fibroid plan. There's supplements for endometriosis. If you have endometriosis in place, we can impact on your fertility. You can use supplements as hormone balancing supplements like hormone essentials, like Vitex, like chasteberry, and anti-inflammatory agents such as turmeric, such as flaxseed oil, and such as shark liver oil or shark cartilage. And then there is a herbal supplement known as no xeno. In other words, no synthetic hormone, no xenoestrogen. All right. And then number 8 is to enhance implantation and prevent miscarriage. Now, one of my mentors told me that hibiscus flower tea can actually prevent successful implantation, and that a woman who is trying for pregnancy should avoid hibiscus flower tea. Incidentally, hibiscus flower tea is one of my own best teas, and it's very fantastic, particularly for those who are dealing with cardiovascular issues like hypertension. Hibiscus flower tea is fantastic. But if you're trying to achieve pregnancy, it is contraindicated for you because it can cause implantation failure. So there are some things you may be eating that is not allowing implantation to take place. Then you can use Balanced Woman Cream, which is actually natural progesterone that is extracted from wild yam and formulated into a cream. You just rub a little at the back of your hand in the morning, maybe a little around your neck in the evening. That's all, twice a day. And it helps to elevate your progesterone level and balances it out with estrogen so that you don't miscarry, all right? You can use vitamin B12, B6, and folic acid. That helps. And once you get pregnant, then don't delay in registering for antenatal care so that they can begin to take immediate care of the pregnancy so you don't lose this pregnancy, precious pregnancy that you've been waiting for and praying for all these years. Where you need bed rest, your physician will advise, and they will do the needful in order to help you preserve that pregnancy for the next 9 months so you deliver a live baby. So pregnancy care is very important. Avoid self-medication, particularly during the first trimester of your pregnancy. That's when the vital organs of the baby are forming, okay? Even anti-malaria drugs, even paracetamol, please don't take any medication except one that is prescribed for you by your qualified and licensed physician. And if you are seeing any doctor, even if you are 2 weeks pregnant, 3 weeks pregnant, and the doctor is prescribing, let the doctor be aware that you are pregnant. Because the doctor may not know that you are pregnant, 1 month pregnant, 2 months pregnant. He may just prescribe an anti-malaria drug for you, and that malaria drug will now destroy that pregnancy. So let your doctor know that you are pregnant so that the kind of medication they give you are not contraindicated for the pregnancy you are carrying. And don't self-medicate. During pregnancy as well, eat a balanced diet throughout your pregnancy because you are eating for yourself and for your baby. And eat well-nourishing meals. Of course, when you go for antenatal, they will prescribe some vitamins and minerals for you, particularly folic acid, all right?
All right, I was in talks with the executives of the foundation. We're talking about this. So they're still putting heads together to see how we can get the full text. You see that this alone is hosted on the YouTube page of the foundation, where we can go over again to watch it, or a link is going to be made available to us so that we can catch up with the other parts of the session. So that's about all for the seminars for today. And you started it, and here we are. It's worth celebrating ourselves. So you want to put your hands together for yourself, because you have just started a thing and you have seen it to the end. So it means you are an achiever. And at this point, we will want to take that deep. Are you ready for us, Ma? Okay, like I said earlier, that they were still consulting about how to go about this. But
nutrients, and they just refuse to take it. I have heard women who are saying, "I
okay,
by faith." That is
Volume,
that is presumption, because those are not drugs. Folic acid is not a drug; it's a vitamin, one of the B vitamins. Iron is not a drug; it's a mineral. Okay, and you need them. The baby needs them in order to develop well. So for you to say, "I will just collect it and put it in my locker, I will not take it," like we say in Nigeria, you are doing yourself. God forbid. All right. So use all recommended supplements, the vitamins, the minerals, the amino acids, the essential fatty acids that your doctor prescribes, okay, for your pregnancy care. That's very, very important. And if there is cervical incompetence, your gynecologist will know it. They can tie the womb, put you on bed rest, and help you to successfully navigate to the end of your pregnancy. Now, for husbands, if you have erectile dysfunction, again, don't sweep it under the carpet. Do something about it. If you have low sperm count, boost your sperm count. Boost your sperm quality, the quantity and the quality, so that the morphology and the motility of your sperms are good. And that helps, the sperms to be able to successfully fuse with the egg and fertilize the egg. Again, I have developed a simple 1-2-page plan how to boost sperm count. If you send me an email to tony@tsfchurch.com, I'll be sending you that plan free of charge as well. Things to eat to boost your sperm count will include things like cucumber, things like carrots, like ripe tomato, like ginger, like garlic, like brown rice or fada rice. Okay, these are things that are rich in zinc that can help. Now, supplements like hawthornberry, like L-arginine, L-citrulline, all of these saw palmetto, they help in boosting the sperm count. Then if you're an absentee husband or you and your spouse are always in conflict, that also has to be addressed. So these are the dietary and lifestyle suggestions that can help to enhance fertility in a couple.
If you have any
Thank you very much. I'll be very glad and happy to answer any question that may arise. And I pray for those who are trusting God for the fruit of the womb, that God will visit you, that in the next 1 year, as the Lord lives and the Spirit lives, you and your spouse will carry your own brand new baby to the glory of God. In Jesus' name I pray. Amen. Thank you. I love you. God bless you. And once again, I want to thank everyone and the leadership of the foundation.
Let's put our hands together for Mr. Tony Akinyemi for that wonderful session. And by the way, I know by consultation, it's been established that the text, this video will be available on the website of the foundation, www.parahfamilyfoundation.com. So you can go there, maybe maybe a day or some hours after now, and you'll be able to access that. Are there any questions for him? Because he's online, and we'll take those. Okay, let's take that question and then go to take the deep and round up the session. Sir, if you can hear us, can we hear your voice, sir? We want to be sure we are together, sir.
Hello, hello, hello. Thank you. I can hear you. Can
Can
you
you
hear
hear
me?
us? Looks like I'm about to.
There's a lot of echo.
Good to go, 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 good to go. Hello, 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 hello.
Hello, hello, hello. I can hear you clearly.
Okay, sir.
I can't hear you anymore. I cannot hear you anymore.
I'm not sure. Okay. All right, let's just curate those questions. We'll find a way to send it across to him, and he will give responses to those questions. All right, please, one more time. One more time, I want to invite to the podium for the Lucky Deep now, the visionary of Parah Family Foundation, ably assisted by other members of the Board of Trustee, to carry out the Lucky Deep. Please put your hands together for Princess Dayo Odukoya, ably assisted by other members of the Board of Trustees as they come to do a presentation for that lucky couple among many other lucky couples. Please, let's celebrate them. It's ably supported by the husband and the co-visionary, who is also.
Hope your mind is not doing.
Maybe I should take microphone to the heartbeats.
Or maybe we should do. We should check your temperature to be sure that you are still here.
All right.
Okay, so I want to believe that. Okay, first and foremost, let me appreciate everyone that have joined online today, and I want to believe that everybody has, been richly empowered to go and start taking action. And I want to also say that by the time we are converging again next year, we'll have so many testimonies in Jesus' name. So today, yes, last year, like we said earlier on, the economy is really going through a lot. And the dollar last year was not what it used to be today, or what it is now is not what it used to be. So those drugs has, gone up, and the cost of fertility or fertility treatment has really gone up. And we just have one free IVF to give out today. And I want us to appreciate one of our partners that have donated this to us. Let's, appreciate them. Even in this time and season, we are still able to get this support. Then secondly, we are going to have another free fertility investigation to a family that is seated there as well. So I believe we have been giving numbers when we came in. Everybody has a number. I want to call Mr. Representative of Mrs. Omuzurugo. Is he still here? Please appreciate them. Appreciate him as he comes up. He's going to help us to pick.
Let's celebrate the gentleman who has the golden hand.
You're welcome. Thank you.
I hope
He's
somebody
going
is
to
picking
pick,
those hands.
and then a number is going to be called.
Let me touch his hand on your behalf. That one, that's the one you should pick. Are you ready, sir? Oh, someone is getting blessed already. And there goes the number. Wonderful. I hope you have brought out your numbers to check. Yes, princess.
Maybe the person is here. Well, I mean, the couple are here or not, we'll know. PFF 76.
FF 76. FF 76. That is the number. PFF 76. In here or not?
Have to pick another one.
Absent. Wow.
Yeah, another one.
So we do another draw. Another draw. Another draw. And there it is.
Well, I can't see the number very well.
So some people's hearts are palpitating already.
All right, since PFF 76 is not here, PFF 14.
FF 14. FF 14. FF 14. FF 14. He has gone to the convenience, or he has gone away.
We are rolling the dice again for the next person.
FF 14 not here.
Okay.
Somebody is about to get lucky, fortunate, blessed. And that's the third draw.
PFF.
Are you there?
8.
PFF 8. PFF 8. In fact,
you have not lost your sleep. Okay.
Whoever takes this eventually, that person is very special.
After now, we won't do it again.
Now this date. I think this is it. It's smelling like it.
PFF. PFF 23.
PFF 23.
What is happening? They've all gone? Or some people are praying? Don't answer by fire.
PFF 23. Okay. Okay. That's the fourth.
Okay. PFF 53. Okay, after now, let's move to the second one. That's the free fertility investigation. Okay. Please, can you come forward, please? Dr. Kemi Ailoje.
PFF 24.
Okay, there you have it. There you have it. There you have it. Is this for the investigation?
And upturn until he gets to that whom I've rightfully given it unto. Congratulations.
Congratulations, sir. Congratulations, ma.
They wanted to make it test. I've converted it for you. They should give you free IVF cycle.
Wow, let's put our hands together. Let's celebrate this happening in the house. This is wonderful. This is wonderful.
So
This is awesome.
The slots of all those people they've called would give it to them because God says, I will upturn and upturn and upturn until I'll give it to those who rightfully deserve it.
And now is their turn.
Turn.
And now it is your turn. Congratulations.
So
Congratulations.
we have one more to go.
Congratulations.
God works in mysterious ways.
Yes, sir.
Dr. Kemi was almost on her way when we insisted that she must come back. And she honored that invitation, and this is the result. Let's put our hands together for God and for our doctor. Congratulations.
All right, the happy faces captured there, and then we go to the
quickly
last one.
This is the last one and the only one remaining.
Let's appreciate Dr. Kemi one more time.
God bless you, Dr. Kemi. Thank you. God bless you.
I just want to say something about this because you know, I kept asking her, are you not going to do something for us this year? Said, let's just, in fact, here today, she was telling me 2024. No, that she wasn't going to do. And I said, okay, give us free investigation. And she obliged. Well, look at what God has done. Mercy has found this one. And it is actually their turn because, again, she's a specialist of older couples. Every older couple that she took from here, they carry their pregnancies. And theirs will not be an exception. In Jesus' name. Congratulations. Thank you, Dr. Kemi.
You can go now.
Thank you so much. That for which
It
you are
will not
delayed.
be an empty testimony. The same, some people have come and gone empty-handed. It will not be a show. It will be, by next year, you won't be here. You'll be nursing your children. In 2 years' time, they'll put you for other families to be blessed. Every time you wake up, just say, I give God all the thanks and all the glory. God bless you. Have a nice day.
Thank you.
Okay, thank you so much. What's your steps?
The couple in white. What's your number? Couple in white. 35. So the next investigation, there's free for them. Congratulations.
Thank you so much. God bless you. Thank you so much.
Okay, so let's do the last one. The last one. Going. PFF. Are you all with us? PFF 29.
PFF 29. Okay, you want to call your own number by yourself.
Okay. I have one now. PFF 66.
Let's celebrate with her. Celebrate with the family. PFF 66 at last. After going round, kids have been waiting for you guys all along. Congratulations. 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 So we bargained for one. We got
Say something about what just happened, and that's really got me emotional. on Thursday, on Wednesday, where I usually do my nails, I was there. I met a lady, she was sharing challenges and how she left her marriage and all of that. So I got counseling and all of that. But the guy that was attending to me, I've known him for a while. And I think she was sitting behind. She walks with him. I didn't know. But they ran after me when I finished. And the guy was like, Madam, I know you have been doing this thing for a while. This lady wants to talk to you. Please help me attend to her. And that was how I shared my information. And I said, if you can come here today with your husband, only couples will be attended to. And that night she registered. And
Yeah. And here we are. Awesome.
Congratulations.
Awesome. Congratulations. Miracles still happen. Congratulations. Now it's your turn. That is why I'm sure that your testimony is next. Let's put our hands together to celebrate Dr. Kemi Ayode, to celebrate Parah Family Foundation, the Board of Trustees, the visionary, King's Will Hospital. Thank you for coming. That was with Mr. Joshua, right? All right. Thank you for coming. And I think at about now we have done all what needs to be done. And we are beginning the preparation for the 7th edition already. Thank you for being a very wonderful audience. Thank you for coming around. We look forward to hearing those good news from you. Please put your hands together and make welcome Miss Sioma as she comes to give the parting charge. Thank you and God bless us all.
Good afternoon, ladies and gentlemen, our esteemed speakers, and all of our guests. It's been an amazing, amazing day for everyone that has stayed and had come through with us since morning. We want to say a big thank you. We are not forgetting all of everyone online. We appreciate you. I'm still getting messages from online. That means their participation has been from morning. Thank you for staying in. I stand here on behalf of the Board of Trustees of Parah Family Foundation to express our heartfelt gratitude to each and every one of you for making this fertility conference a resounding success. To our distinguished guests, your insightful presentations and expertise have enlightened us and inspired hope in the lives of many. Your contributions have been invaluable, and we thank you for sharing your knowledge with us today. To our attendees, both online and offline, your encouragement, your questions, your discussions here made the conference very, very dynamic and enriching experience to everyone. Your passion for the fertility, to go on your fertility journey and your quest to understand your reproductive health is the drive that keeps us going forward in Parah. To all our team members, our volunteers, your tireless efforts and dedication have been remarkable. Your hard work has ensured a seamless and enjoyable experience for us all. To all our sponsors, your support has been instrumental to making the conference possible. Your commitment to the fertility conference and the reproductive health of people is truly appreciated. So we thank you so much. Thank you everyone again for your contributions. Thank you for your participations. Thank you for your enthusiasm. And let us continue to do the work together to advance fertility care and improve the lives of people. God bless you. Before we go, we would also want to encourage you that you can continue to follow us and engage with us on all of our social media platforms at Parah Family. So on Twitter, on Facebook, LinkedIn, and all other, and X, you can connect with us at Parah Family Foundation. And on our website, www.parahfamilyfoundation.com. We also would want to take our confession. Okay, thank you. Thank you, ma'am. Okay, great. Thank you. Okay, so we have these books. It's at our book stands. And for many of us in Parah, just to say that I came to Parah also trusting God for a child. Albeit I'm a board of trustee member, but I also came trusting God for a child. And today I have 2 children of my own. Some of those books have been very helpful to us. So we encourage you to pick a copy. Each of them is selling for 1,000 naira. You too can be fruitful by Mrs. Mary A. Abioye. There's another one here, You Are Not Barren But Waiting, from Tokpe and Yemisi Olamilekon. We have The Blessings of Sarah, and we have The Journey to Parah, also at the book stand. So please just move towards the book stand and have conversations with the people there to pick a copy. We also want to take our confessions. In Parah, we believe in confession. We know that there is power in the spoken word. We recognize that things don't just happen when we speak negative. And I'm grateful that Dr. Akiemi had told us about stress by negativity. So we want to speak positively as we go today. Our confessions are based on the word of God in Parah. So we get most of our confessions from scripture. Can we have it up? So we can. It's digital, right? Yes, so it's digital. So everyone can we rise, please? So we'll take our confession together. Are we having the voice? Yeah. Okay. No, it's here, so we can read from here. Okay. Can we do this?
Heavenly Father, we thank you for your word that is settled in heaven and your faithfulness that endures to all generations. You have blessed and commanded that we should be fruitful and multiply. Your word assures us that you will bless the fruit of our body and
none shall be barren.
Children
are the heritage of the Lord.
The fruit of the womb is his reward.
We shall not be left out of your reward.
Thank you,
Thank you, Father God, that we are joyful parents of children. Body, we speak to you in Jesus' name. You come in line and agreement with the word of God. Every organ and tissue in our bodies will function according to the original plan, and we forbid any malfunction in the name of Jesus.
We have it.
We have it now. We declare we are fruitful.
Thank you,
Father. In Jesus' name.
Your testimony.
Amen. Your testimony is next. God bless you, and we'll see you at the 2025 Fertility Conference by God's grace. Have a blessed afternoon. Announcements, please. Next month, we are having a physical meeting. If you are coming for the first time, please make yourself available for that physical meeting. It's going to be at Ikeja. Ikeja, please. You will send messages to your phone. Please make it, yes, please. We want to be able to meet with you personally so that we can have your next step. You can talk about what do you do next. What decisions are you making for the next step? Okay, please. So if you are coming for the first time, make sure you come for next month's meeting. It's going to be physical at our Ikeja Center. Thank you. We are made. We are made.